If any councils are watching in their offices that are on the Board of Health, please come to the chamber or log on. Before we start, I'll just announce who's in the room. Director Chandra Balance here, Director Zhao, Councillor Thompson. Online we have Director Ozude and Director Singh, and myself, Councillor Moyes. Okay, we have quorum. Councillor Brooks is here. So good morning. My name is Councillor Chris Moyes, and I am the chair of the Board of Health. The Board Direct Secretary has confirmed that we have quorum, so I'll call meeting 8 of the Board of Health to order. Welcome, everyone. Today's meeting is being held with board members and city staff participating both by video conference and in person at City Hall in Committee Room 1. City Hall is open to the public, and anyone is welcome to attend this meeting at City Hall today. The public may continue to participate electronically by video conference. This meeting is also being live streamed online at youtube.com/Toronto City Council Live. I ask everyone for their patience with any delays and technical issues. The clerk staff will connect all remote registered public speakers to the meeting by audio. The list of speakers can be viewed online by visiting the Board of Health page at toronto.ca/council and clicking the speakers box for today's meeting. The board secretary has also emailed the speakers list to the directors. Directors, this is a paperless meeting. The board secretary has provided all agenda materials on toronto.ca/council and via CMP, the clerk's meeting portal. Directors, please keep your mic muted unless you wish to question staff or speak to an item, and ensure that your video is turned on. As part of each agenda item, I will ask directors to raise their hand or unmute their mic if they wish to question staff or to speak. I will then create a speakers list and will call on directors when it is their turn to speak. When voting on an item or a motion, I ask that directors ensure that they turn on their video and to raise their hand to indicate their vote. Directors, I want to remind you that you must submit and approve your motions by email. Staff are available at boh@toronto.ca to help with motions. I'll now start with the land acknowledgement. The Board of Health acknowledges the land we are meeting on is the traditional territories of many nations, including the Mississaugas of the Credit, the Anishinaabeg, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. Today, this meeting place is still the home to many Indigenous peoples from across Turtle Island, and we are grateful to have the opportunity to work and live on this land. As public health professionals and members of the Board of Health, we recognize the historical and present-day traumas inflicted upon Indigenous peoples. We stand with communities and families as they mourn the loss of loved ones who were sent to residential schools and never returned. We also acknowledge our complicity in ongoing colonial violence. We commit to supporting the efforts of Indigenous groups towards reconciliation and action-oriented practices, including the equitable use of resources. We strive to learn Indigenous histories and collaborate with communities and families so we can create safe spaces that honor Indigenous cultures and ensure that Indigenous perspectives are present in our work and our practices. As a Caribbean Canadian, I'm committed to continue acting in solidarity with our African, Caribbean, and Black communities seeking freedom and reparative justice in light of the history and ongoing legacy of slavery that continues to impact our communities across Canada. As part of this commitment, I would also like to acknowledge that not all people came to these lands as migrants and settlers. Specifically, I wish to acknowledge those of us who came here involuntarily, particularly those brought to these lands as a result of the transatlantic slave trade and slavery. In support of the City of Toronto's ongoing efforts to confront anti-Black racism, I pay tribute to those ancestors of African, Caribbean, and Black origin and descent. Are there any declarations of interest on the Municipal Conflict of Interest Act? If you have an interest, please raise your hand or unmute your mic and indicate the item number and the nature of the interest. Seeing none? Okay, wonderful. Before I continue, joining us is Councillor Bravo and Deputy Mayor Malik. Next, we need a motion to confirm the minutes from our last board meeting on October 23rd. May I have a motion? Councillor Bravo, all those in favor? Opposed? Carried. Okay, I will now start. I do have some remarks before we continue. So earlier this month, the Mayor Chow, Dr. Davila, and I initiated the Fight the Flu and COVID-19 vaccination campaign at Metro Hall, where we responsibly receive both vaccinations to safeguard ourselves and those we interact with. The vaccines we are offering are proven safe and effective, providing essential protection against infection and severe illnesses. For those who haven't yet, I urge you to use the provincial booking system at toronto.ca/bookvaccine to schedule your COVID-19 vaccine appointments. This platform also allows you to opt for a flu vaccine. If you're looking to book a flu vaccination appointment only, visit Toronto Public Health's appointment booking system at tphbooking.ca. Last Monday, Deputy Mayor Malik and I, along with Dr. Davila, Board of Health members, public health staff, city staff, and community stakeholders, unveiled Our Health, Our City, a mental health, substance use, harm reduction, and treatment strategy for Toronto. This strategy represents the accumulation of a collaborative effort showcasing the diverse voices of Toronto's communities. Our Health, Our City is more than just a document. It symbolizes our unwavering commitment to the well-being of every Torontonian. In envisioning a Toronto free from mental health and substance use stigma, this strategy paves the way for accessible healthcare services, resources, and community spaces. Acknowledging the deep-seated root of mental illness and substance use in social discrimination, inequity, and trauma, our strategy emphasizes the need to invest in preventative measures in families, neighborhoods, and communities. Finally, as most of you are aware, the Government of Ontario COVID-19 funding will conclude in December 2023. While steps towards demobilization have taken place over the course of 2023, the end of the province's funding requires a full demobilization of Toronto Public Health's COVID-19 structure and the integration of our responsive to COVID-19 into routine operations. This restructuring will help us address the evolving needs of our community. As highlighted in 2023 Population Health Profile Report, and intensify our commitment to making data-informed decisions. The restructuring will include the establishment of a centralized public health medicine program area that will house all associate medical officers of health, creating a directorate specifically responsible for health promotion across the lifespan, making a strategic investment in mental health, substance use, harm reduction, and treatment services, consolidating several support functions, including health informatics, quality and information, epidemiology and surveillance, research and ethics, and library services, and bringing together many of our public health clinical services under one directorate. I want to reassure everyone that these changes will not reduce the number of full-time employees at Toronto Public Health. Full implementation of these changes is planned for January 2024, and it will ensure that Toronto Public Health continues to deliver high-quality public health services, respond effectively to future challenges, and meet the public health needs of Torontonians effectively. I'd like to take this opportunity to thank all of the staff at Toronto Public Health for your passion and commitment to the health of Torontonians. Together, we are making our city healthier, stronger, and more resilient. And Dr. Davila, do you have a few words?
Yes, thank you, Chair Moyes, and good morning, everybody. As you've just heard, we are about to embark on discussions that carry significant weight in this morning's agenda. And so with that in mind, I want to first highlight the collaborative spirit that has shaped the first document that we're about to delve into in today's agenda. The strategy at the center of that conversation, as you've heard, is the document Our Health, Our City, a mental health, substance use, harm reduction, and treatment strategy for Toronto. And I think it's important to emphasize that this document is not the product of bureaucratic deliberations, but rather the result of extensive consultations, including with members of the Board of Health, to ensure that the diverse perspectives and needs of our city are reflected in its design. I think it's also important to emphasize that this is not just a document or a strategy for the Board of Health or for Toronto Public Health, but rather a strategy for the entire city. To be successful, it will require the concerted efforts of all levels of government and community organizations and the city's residents, and then some. The strategy is a call to action for a citywide collaboration that goes beyond institutional boundaries. Moreover, Our Health, Our City recognizes that addressing mental health and substance use challenges necessitates the collective strength of our entire community. It's a roadmap designed to bring together all segments of our city, requiring the active participation, as I said, of governments, community organizations, residents, and the full plethora of stakeholders. The drug toxicity crisis was mentioned by Chair Moyes in his opening remarks, and there's no question that this has a profound impact on our community. As a public health physician, I want to stress, in fact, need to stress, that this is not merely a public health issue. It is, in fact, a human tragedy unfolding in our midst. Each life lost is a stark reminder of the urgent need for comprehensive, community-driven solutions. Beyond mental health and substance use, the Board of Health will also consider today public health's role in monitoring and addressing the impacts of climate change on the health of our community. There's no question that the far-reaching consequences of climate change demand our attention as we navigate the complexities of public health in this evolving landscape. Here, climate change isn't just an environmental concern. It's a health concern whose effects are felt most starkly by the most vulnerable. And additionally, today, we will delve into the importance of childhood immunization as part of our agenda. The presentation you will hear on this subject today emphasizes the importance of investing in the life-saving protection provided by vaccines. And you'll also hear about how the pandemic has impacted population immunization coverage. So as you see, the challenges before us are significant, but our city has demonstrated resilience and unity in the face of adversity before. As we've seen during the pandemic, when we pull together in the same direction, we can achieve remarkable outcomes. The reports and strategies that you will hear about today are not isolated documents. They are blueprints for a healthier, more resilient Toronto, requiring the collective strength of our entire community. I appreciate the collaborative efforts that have brought us to this point, and I look forward to the collective journey ahead. Thank you, Mr. Chair, and I'll now hand it back to you.
Thank you, Dr. Davila. Just a reminder to those in the room, the speakers list will close at 10 a.m. this morning, so if you haven't registered yet. We will now review the agenda. So item HL 8.1, Our Health, Our City, a mental health, substance use, harm reduction and treatment strategy for Toronto. There is a staff presentation and registered speakers on this item, so I will hold it down. Item HL 8.2, Enhancing Immunization Coverage for Toronto School Age Population. There is also a presentation and speakers registered for this item, so I will hold it down as well. Item HL 8.3, Public Health Impacts of Climate Change in Toronto, a path forward for responding to the climate crisis. There is a presentation on this item and also a registered speaker, so I will hold this item down. HL 8.4, Cannabis Stores and Revenue Sharing. There is one speaker on this item, and I also have a motion on this item, so I will hold it down. Item HL 8.5, Proposed 2024 Schedule of Board of Health Meeting. Would anyone like to move this item? Director Chandrabalan. All those in favor? Opposed? Carried. Thank you. Okay, I think that's it. So item HL 8.1, Our Health, Our City, a mental health, substance use, harm reduction and treatment strategy for Toronto. We're going to have a presentation on this item, and Dr. Davila is going to introduce the members, but just as an FYI, if this is okay with the members, some of the panelists do have to leave shortly after. So what I'm hoping to do, is that the board can ask questions of the panelists, and then we'll have deputants come and speak, if that's okay for everybody. Yes? I'm seeing nodding of hands. Okay, so Dr. Davila, go ahead.
Thank you, Mr. Chair, and I do believe we have a slide deck which should be coming up very shortly. And while the slides come up, why don't I get going with the presentation in the interest of time? So, as you heard through the Chair's opening remarks, last week we observed National Addictions Awareness Week across Canada, during which we made public Our Health, Our City, a mental health, substance use, harm reduction, and treatment strategy for Toronto. Before we kick off this presentation in earnest, I would like to extend my heartfelt gratitude for the leadership of Deputy Mayor Malik and Board of Health Chair Moyes, along with many other Board of Health members who were present, as well as many leaders in the health and social services sectors, some of whom are here today, and our City of Toronto Division colleagues who joined us. Again, some of them are here in the room today as well. We're now going to walk through the strategy in greater detail today, and today we hope to begin a new and ambitious chapter for our city. This is an important milestone and a demonstration that the City of Toronto and Toronto Public Health are committed to the well-being, mental health, and safety of all of the city's residents. This strategy is the culmination of hard work, collaboration, and community engagement, and dozens of individuals contributing to the final document you are now considering. I want to thank all of the partners that were involved in co-creating this strategy. This includes people with lived and living experience, leaders from the health and social services sectors, community leaders, and of course, our government partners. I'm grateful to our colleagues across the City of Toronto because this strategy builds on years of hard work undertaken by numerous City of Toronto divisions, alongside community partners and leaders, including Toronto Employment and Social Services, Social Development Finance Administration Division, Shelter Support and Housing Administration, our People and Equity Division, Toronto Paramedic Services, Toronto Police Service, and of course, my colleagues at Toronto Public Health. I also want to thank you, the members of the Board of Health, as well. Thank you for meeting with us in the development of this strategy, for engaging with us and providing us with your input as we put pen to paper on this strategy. And of course, I need to take a moment to thank the incredible team, as always, at Toronto Public Health. I especially want to thank the mental health, substance use, harm reduction, and treatment strategy team for all their work, their incredibly hard work over the past year. Mark Gaspar, Kirthana Alankaran, Jennifer Levy, Katie Milan, Analia Epi, Michelle Jubin, Oluremi Adewale, and Kelly Crow, who with the leadership of Associate Director Sonia Bourgeois, led the development of this strategy. I also want to express my gratitude to Associate Medical Officer of Health, Dr. Shavita Patti, Associate Directors Vanessa Fletcher, Joanne Figliano-Scott, and Dominic Popowich, who've been working behind the scenes to help the successful launch of this strategy. Of course, our public health communications team, led by Director Megan Kilty and her team supporting this strategy, including Michael Blackburn, Jamie McEachern, Michelle Simpson, Amy Frenchman, Keisha Mayer, Dane Griffiths, and Julian Frasca, all of whom were instrumental in the successful completion and launch of this strategy. And where would I be without the members of the Toronto Public Health senior management team and staff who contributed insights and feedback throughout the process? There's a lot of thank yous here, so please bear with me, members of the board. It is also worthy of recognition and thanks are the management team at the Works, Sean Hopkins, Chris Langford, Emily Frenette, Harpinder Sidhu, Laura Schering, Leah Bolhauer, Chris Guthrie, Nick Scrivo, Samira Walji, and Sana Imran. And most importantly, I would like to express my deep appreciation and gratitude to the frontline staff at the Works program who are supporting people who use drugs, leading life-saving work every single day. And last but not least, to Upala Chandrasekhara, who is at the presenters table and who you will hear from very shortly, for her leadership in the development of this strategy, her leadership in guiding the important clinical services that we provide in our harm reduction program. Upala, my sincere and undying thanks to you. So speaking of Upala, today she will be walking us through the presentation, outlining the current mental health and substance use landscape that we're responding to at this moment in time, and presenting key aspects of the Our Health, Our City document and strategy, and discussing next steps. So let's move to the next slide, where I now have this opportunity to introduce two esteemed guest speakers who are joining us today, and you see them at the presenters table alongside Upala. You have Dr. Kwame McKenzie, CEO of the Wellesley Institute and professor in the Department of Psychiatry at the University of Toronto. He will discuss Thrive Toronto and how this mental health plan aligns with Our Health, Our City. Kwame is a person who needs no introduction, well-known and extremely well-regarded on so many levels. Kwame, thank you for being here today. And also, somebody needing no introduction, a true public health and city champion, Susan Davis, Executive Director of the Gerstein Crisis Center. She will be speaking about the proposal to launch a 24/7 crisis stabilization space to address substance use and related mental health challenges. So, continuing on with a little bit more of introduction and overview. Let me just start with this. Our city faces escalating mental health and substance use related challenges, exacerbating pre-existing inequities. We know these challenges are not unique to Toronto. We also know that addressing them effectively demands a strategy tailored to our city's distinctive needs and our unique dynamics. Our Health, Our City unifies mental health and substance use, recognizing shared social determinants of health, such as housing, income, and education. It is important to note that not all substance use issues are related to mental health, and not all mental health issues are about substance use. That's a point that is worthy of repeating, so I will say it again. Not all substance use issues are related to mental health, and not all mental health issues are about substance use. We're on to the next slide. It's important to note that mental health and substance use exist on a spectrum from good health to illness, with substance use that ranges from beneficial use to no associated harms to outright disorders. Our Health, Our City is a comprehensive approach that addresses the needs of all Torontonians, no matter where they fall on these spectra. We need a robust and coordinated healthcare and social support system in our city. One that can manage complex mental health and substance use needs and provide people with the prevention, harm reduction, treatment, and wraparound supports that they require to stay well. So with that, I will now hand it over to Upala Chandrasekhara to present the strategy.
Thank you so much, Dr. Davila, for your advice, guidance, encouragement, support throughout the last year and a half as we developed the strategy. I'm thrilled to present this strategy to the Board of Health today. This comprehensive strategy was born from extensive collaboration and community engagement. It aims to address the complex mental health and substance use issues facing our city. Is that loud enough? Beginning with the next slide, I want to emphasize that Our Health, Our City builds upon years of city initiatives, such as the original drug strategy, which was established in 2005 and has been updated to align with the current landscape, and the Toronto Overdose Action Plans of 2017 and 2019. The work I'll be presenting ahead also aligns directly with the provincial mental health and addiction strategy, which is called the Roadmap to Wellness, the National Mental Health Strategy, as well as the newly released Canadian Drugs and Substances Strategy. As outlined in the staff report today associated with this agenda item, this strategy fulfills several requests made by the Board of Health, including the development of a comprehensive mental health and addiction strategy, and to conduct community consultations throughout 2022 to inform a refreshed Toronto drug strategy, which is now part of this comprehensive strategy titled Our Health, Our City. Next slide, please. Let's delve into some of the data highlights to understand the dynamics this strategy addresses. Approximately 1 in 5 Canadians face mental health challenges annually, resulting in a significant economic impact. 500,000 Canadians miss work each week due to a mental illness, leading to approximately $6.3 billion of lost productivity annually. The Center for Addiction and Mental Health, CAMH, has stated that we are in a mental health crisis. Evidence shows declining rates of mental health throughout Canada and novel stressors affecting well-being across the lifespan, including right here in Toronto. In 2021, only 55% of adults in Toronto reported very good or excellent mental health, which is a significant drop from the 71% in 2017. Among youth, just 44% of Toronto students grades 7 to 12 reported very good or excellent mental health in 2019, while 17% reported contemplating suicide in the past year. Overall demand for mental health services has been increasing right across the province, but only an estimated 28% of people in Ontario feel that mental health services are easy to access. Next slide, please. Here's the substance use landscape. Alcohol produces some of the highest burden of drug-related harms and deaths in Toronto. In an average year, alcohol is linked to over 800 deaths, over 4,000 hospitalizations, and over 39,000 emergency department visits in Toronto among those who are 15 years of age and older. Cannabis was legalized in 2018. In 2022, approximately 29% of people over the age of 16 in Ontario reported using cannabis for non-medical purposes in the past 12 months. Tobacco is still, on average, responsible for over 2,000 deaths, over 11,000 hospitalizations, and over 15,000 emergency department visits annually in Toronto among people 35 and older. Next slide, please. As we've discussed here many, many times, we're also in the midst of a devastating drug toxicity crisis that has taken far too many lives across the country and in our city. In 2022, preliminary reports estimated that 509 opioid toxicity deaths occurred in Toronto, marking a 271% increase in reported deaths since 2015. These deaths have been fueled by fentanyl and fentanyl analogs like carfentanil. Benzodiazepines and tranquilizers like xylazine are other concerning substances that have entered the drug supply here in the city. There has also been an observed increase in drug toxicity deaths caused by smoking opioids. Next slide, please. As we've already discussed, this strategy was informed by an extensive consultation process involving 200 participants on 18 community roundtables, which included people with lived and living experience, and population-specific roundtables for youth, African, Caribbean, and Black communities, women, and 2 LGBTQ+ communities. There were 84 external stakeholder interviews, 30 interviews and roundtables with people who use drugs, 13 city divisions, commissions, and corporations were consulted, and the Deputy Mayor's Mental Health Roundtable, which was hosted by Deputy McKelvey back in June 2023, as well as a complete jurisdictional scan of mental health and substance use strategies. A considerable number of the recommendations included in this document were co-created with partners and stakeholders, especially with people with lived and living experience of mental health and/or substance use related issues. Next slide, please. Our Health, Our City envisions a healthier Toronto. Toronto is a diverse and resilient city that prioritizes the mental health, well-being, and safety of all residents. That is part of our vision. Everyone can access healthcare services, resources, and community spaces they need to support their mental health and prevent substance use-related harms with dignity and ease. Mental health and substance use are addressed as health issues rather than criminal issues. And mental health and substance use stigma and discrimination have been eliminated. I'll say that again because it is an important point in our vision that mental health and substance use stigma and discrimination have been eliminated. Next slide, please. Our Health, Our City has 7 goals that are guided by 5 key principles. And those principles are health and safety for everyone, meaningful inclusion of people with lived and living experience, anti-oppression, anti-racism, and decolonization, evidence, innovation, and continuous improvement, citywide, collaborative, and comprehensive. I'll now move on to presenting the goals of the strategy, and I'll provide a couple of examples of recommended actions under each goal. In the full strategy document, you will see a more comprehensive list of the goals and actions. Next slide, please. Goal 1 of the strategy is to promote mental health and well-being across a lifespan. Some examples of this include addressing loneliness and social isolation across the lifespan through community programming and city initiatives that increase community connectedness. facilitating suicide prevention and life promotion interventions for all age groups. Next slide, please. Goal 2 is to prevent and reduce the harms and deaths related to substance use across the lifespan. This goal has 2 sub-goals, one to address the drug toxicity crisis and one to address regulated substances like alcohol, cannabis, tobacco. First, we start with a broad approach to preventing substance use-related harms, and some recommended actions include building resilience and awareness among youth to prevent and/or delay substance use through standardized substance use prevention and leadership programming in schools, community outreach, and extracurricular programming. Next slide, please. As part of Goal 2, we also want to reduce drug toxicity deaths caused by the unregulated drug supply and support those affected by the drug toxicity crisis. This will include providing supervised consumption services, street outreach, and mobile crisis teams as part of a full continuum of services, from evidence-based prevention, harm reduction, to treatment services, to wraparound supports, where evidence and community needs dictate. It also includes permanently funding drug checking services. Next slide, please. As part of Goal 2, we will also reduce the harms and deaths associated with regulated drugs, including alcohol, cannabis, tobacco, and vapor products. We will do this by, for example, supporting programs that prevent impaired driving for both alcohol and cannabis. Next slide, please. The third goal is to expand access to the full continuum of high-quality, evidence-based, and client-centered services to address mental health and/or substance use issues, including prevention, harm reduction, and treatment supports. Some examples of how this will be done include implementing a 24-hour crisis stabilization center in our city, which you will hear more about shortly from Susan Davis. Next slide, please. The fourth goal is to advance community safety and well-being for everyone. Some examples of recommended actions include expanding Toronto Community Crisis Service to be citywide as Toronto's 4th emergency service, and working with local neighborhoods and supervised consumption service staff to improve community well-being and connectedness. Next slide, please. The fifth goal is to improve access to housing and other social determinants of health. This will include creating more affordable housing, including supportive housing for people with complex mental health and/or substance use-related issues, advocating for improved income support, such as universal basic income and increases to social assistance rates, and bettering programs addressing food insecurity to move people and families out of poverty. Next slide, please. Goal 6 is to support mentally healthy workplaces and optimize the mental health of workers. This will involve implementing the national standard for Canada for psychological health and safety in the workplace at the City of Toronto. Next slide, please. Finally, Goal 7. This is to proactively identify and respond to emerging mental health and substance use issues. This involves facilitating data monitoring, research, and evaluation to proactively identify emerging mental health and substance use trends, evidence, and policy changes. Also involves continually assessing and updating City of Toronto public-facing information and data on mental health, substance use, and addictions-related issues. Next slide, please. When we think ahead to the implementation of Our Health, Our City, Year 1 implementation priorities for the City of Toronto include the following 4. Firstly, advocating for ongoing and sustainable funding for shelter services and increasing funding for supportive housing to help individuals experiencing homelessness, and creating more affordable housing, including supportive housing for people with complex mental health and/or substance use-related needs. Secondly, advocating for ongoing and sustainable funding to establish a 24-hour crisis stabilization center for our city. Number 3, advocating for ongoing and sustainable funding to collaborate with first responders and hospitals to implement a coordination protocol that enhances the seamless transfer of individuals experiencing a mental health or substance use-related crisis to the most appropriate service for care. And finally, number 4, advocating for ongoing and sustainable funding to expand the Toronto Community Crisis Service to be citywide as Toronto's 4th emergency service. Next slide, please. I also want to highlight some of the key priority areas for clinical service delivery, specifically for Toronto Public Health over the next year. This includes, firstly, expanding hours of current clinical service delivery and support programs to run 24 hours a day, extending funding for our injectable opioid agonist therapy treatment program, and thirdly, the successful relocation of our works program within the downtown core. Next slide, please. As you've heard, Our Health, Our City is a big and bold and ambitious plan. As Dr. Davila indicated, implementing this strategy will require extensive collaboration and ongoing partnerships. To support the implementation of this strategy, Toronto Public Health has a dedicated mental health, substance use, harm reduction, and treatment strategy team that will be supporting the implementation of the strategy. And this team will be responsible for convening stakeholders, advocating with appropriate levels of government, and monitoring progress on implementation of this strategy. But as Dr. Davila said, this is not just a Toronto public health strategy. Our Health, Our City is a call to action for the whole city to join us in this effort. And we need all of our collaboration partners to come to the table, to work with us, alongside us, collaborate with us to achieve the intended outcomes of this important strategy. Next slide, please. In terms of next steps, you'll note that in the board report, we're recommending that the board we're recommending to the board that implementing Our Health, Our City should be overseen by an implementation panel chaired by a member of the Board of Health and comprised of experts on mental health and or substance use, including people with lived and living experience. At the direction of the Board of Health, a City of Toronto interdivisional table chaired by the city manager and the medical officer of health has already been established to convene senior leadership across city divisions to coordinate efforts and collective action to achieve the intended outcomes of the strategy. The implementation of the strategy will be assessed through an annual progress report to the Board of Health, which will be in collaboration with Thrive Toronto, which Dr. McKenzie will speak about shortly. In addition, the city and Toronto Public Health are actively engaging with Indigenous service providers on next steps to co-develop an Indigenous-specific action plan. Our Health, Our City does not explicitly offer recommendations regarding Indigenous health and well-being, as these are being co-developed right now by this distinct and parallel process. And with that, I turn it back over to you, Dr. Davila.
So thank you, Upala, for the presentation. I will turn it over to Dr. McKenzie so that he can discuss our partnership with the Thrive Table. Thank you, Con.
Thank you very much, Dr. Davila, and thank you very much for inviting me to speak. And I'd like to join you and also join Upala in thanking all of the people who developed Our Health, Our City, which I see as a fine piece of work and a bold plan for Toronto. Most people say that mental health is everybody's business, but they don't take it seriously. And having a bold plan, a call to action to bring the city together, I think is an important first step in really taking that comment seriously, that mental health is everybody's business. I really like not only the boldness of the plan and the call to action, but the fact that the implementation plan focuses on things that the city can do and focuses on things that nobody else is going to do apart from the city, such as housing, supportive housing, such as expanding crisis services built on the crisis response pilot, which has been really great, and because of the big hole in services for substance use, and the fact that the provincial mental health services do not do as much for people with needs of substance use health as the city does. So I really like that. But I'm here to talk about the collaboration with a strategy which was released a couple of months ago by a cross-sector group of people called Thrive Toronto. And Thrive Toronto is part of a wider group of Thrives across North America and the UK, which try and bring cities together, different sectors in the city, to think about mental health. But our strategy is focused on mental wellness and psychological health. And because of that, it's going to work in parallel to the city strategy, which rightly initially is more focused on mental health services. And you might ask sort of why would we need a strategy which is built and really is focusing on mental wellness and psychological health? Why don't we just focus on mental illness? I'm just going to repeat some of the statistics that we heard earlier and some new ones. 48% of grade 7 to 12 students in Ontario have poor mental health, 48%. 50% of grade 7 to 12 students say they are depressed because of the problems of climate change. And 1 in 5 students, 20% of 7 to 12-year-olds, have harmed themselves in the last year, 20%. Now, it's not just students. Next slide, please. You know there's huge amounts of burnout. 35% of people are working but are burnt out. Next slide, please. Loneliness is a huge problem. And in Toronto alone, 400,000 people say they have no close family or friends to call on when they need help. Next slide. We know that 50% of health problems and mental health problems are linked to the social determinants of health, but we haven't got a strategy to deal with that. Next slide. But it is the next problem. 95% of Ontario schools say that despite all of the figures, all of the data we have on school mental health, they do not have enough support for their students. When you see these figures, and when we saw these figures in Thrive Toronto, we came to a simple conclusion. You cannot treat your way out of this sort of issue. We're doing something wrong. We need to change something fundamentally. You will never have enough services to deal with an issue this size. You have to move upstream. You have to decrease the number of people who are getting ill and the number of people in crisis. And if you don't do that, you can't deal with the problem. Next slide, please. So Thrive came together, and the main members of the Thrive table include the city, SDFA and Toronto Public Health, include CAMH, include CMHA Toronto, Family Services Toronto, include people who run the service sector, Ontario Health, and also people who don't look like the service sector but see lots of mental health problems. The United Way GTA, YMCA GTA, and then we have Strides, who are the lead agency for children's mental health. And it was a relatively simple plan. We thought if we got together and if we could focus and if we could commit to working together, we could be more than the sum of our parts. We could leverage what we are already doing to make things better. And so Thrive is relatively tunnel visioned around not just thinking about mental illness, but thinking about mental wellness and thinking about what a cross-sector partnership could do to make things better. And that's how it's going to work so well with Our Health, Our City. Next slide, please. So one of the things that both Dr. De Villa and Upala have done is repeated the important things. There's more to mental health than diagnosable mental illnesses that need treatment. We all know that, and Thrive's strategy is trying to help with that. Next slide, please. So mental wellness impacts everything we do. Thrive worked for 18 months to try and work out what were focused actions vital to mental wellness of our city, which the partners could deliver. And when we thought about the strategy, we thought about 5 things we wanted to do. We wanted to improve mental wellness. We wanted to bring different sectors together. We wanted actions which were based on what we already have, so we wanted to build on our foundations. We wanted to ensure that groups such as employers who are doing a lot of mental health work are linked to the whole sector. And we also wanted to help people and communities help themselves. But we wanted it to be modest, focused, and deliver. We wanted small actions that could leverage big change. Next slide, please. And these are the 5 key actions we came up with. A community mental health report card. It is impossible to get everybody rowing in the same direction if they haven't got a plan. And that's one of the reasons why we love Our Health, Our City. But also if they haven't got metrics that they all agree on. A report card that comes out every year so we know what the targets are, we know where we're going. A report card that brings different parts of the sectors together with one voice. We know that lots of people are working on climate change, but we do not have a climate change strategy for mental health. And so we wanted to create that. Again, this idea of bringing different sectors together, building on what we've got and making change for the city. We will work with Our Health, Our City to improve housing and really like the focus on supportive housing and the supportive housing growth plan that has been created by the Toronto Alliance to End Homelessness. If we worked on that together, we would be moving things forward. We like support for the workforce, but we want to work with the city to do something slightly different. There's actually a huge amount of work and money in EAP programs, employee assistance programs, but they're all different. And they tend to focus on getting people help when things go wrong. So we're interested in going upstream and speaking with those employee assistance programs and saying, what can you do to improve mental wellness? What can you do to promote mental health? What can you do to stop people getting ill? And how can we work with you to make that part of an EAP? And last, we want to create a learning centre to help individuals, to help communities, to help employers, to help employees know what they can do to promote well-being and positive mental health. And we think those 5 things together, certainly for the first 1 or 2 years, are high-impact things that we can do together to move things forward. Next slide. And these things link very nicely with Our Health, Our City. Not surprising, perhaps, because the city was at the table when we were developing the Thrive plan. But the mental health report card's going to be key. Action to improve housing and other social determinants of health, key. Looking at mental health in the workplace, if you can get that right, that makes a big difference. And last, that our Health, Our City strategy, goal 1 of improving mental wellness, well, that is what Thrive and Thrive's mental health strategy is all about. So I wanted to commend our Health, Our City. I wanted to say that I'm quite excited by our Health, Our City, and wanted to just really talk in support of it and say that the sister strategy of Thrive is a strategy which will work hand in hand with our Health, Our City for the good of Toronto. Thank you.
So thank you, Dr. McKenzie, for that presentation. You heard about the value of upstream. I will now turn it over to our colleague Susan Davis, also at the presenters table, to speak about the proposal for a 24/7 crisis stabilization space, because clearly not all the action can happen upstream. There are some clear needs in the city that are present now and are about actual issues in the present time. So Susan, over to you, and thank you again for being here.
Thank you so much, Dr. Villa. It's exciting to see our Health, Our City, an action plan in place. It's great to see us connect them to other plans that we have developed. But along with plans come action, and I know that Dr. McKenzie just named some actions, but some of the actions really need to be at the very front line, at the level where people are accessing services and creating increased access, equitable access to people who are living with mental health and substance needs in our community. I'm presenting as the Executive Director at Gerstein Crisis Centre, and I'm not sure if everybody knows what Gerstein Centre is, but we are a 24-hour crisis service in the city, and since 1989 have been providing community-based, trauma-informed, equity-focused crisis services through a telephone crisis line, mobile team, as well as crisis beds and short-term follow-up in the community. And most recently connected with the Toronto Community Crisis Service as an anchor partner in the downtown east for now, and then hopefully through expansion covering South Toronto and into South Etobicoke. So we also are, as of November 30th, going to be partnered with 988 with the strategy that goes across the country for access to suicide intervention, and we'll be answering calls through that number as well. So we know collaboration is the way forward, and we've worked in that way for a long time. I was really, impressed that the Our Health, Our City report really did do a very comprehensive collaboration with many, many stakeholders within the community, including people with lived experience. I think that's really key when we're looking at what is it that people need and how we're actually going to address it. Hearing from those who live with the concerns that we're trying to address is always paramount in terms of determining where we are going to go. And the Substance Use Crisis Centre for Toronto really does come out of that voice. We've been at this for a long time, and Board of Health has supported this all the way, but most recently we've been working with the Downtown East Toronto, Ontario Health Team with a group of people to look at the further development of rapid access to crisis support. And Jason Altenberg from the South Riverdale Community Health Centre and myself co-chair that committee, but there are many partners there, including the City of Toronto, Public Health, and people with lived experience. So this report is already in, this proposal is already in front of the Ministry of Health. It's going to be resubmitted again with some updates this year, and I'm really excited to see it be part of this particular plan. So I want to walk us through a little bit. You can change slides. Just talking about the history of this project and some of the context, what's leading to it, what the action is that people are asking for, what the design is, and then maybe I can hear from you if you have any questions. New slide. So acknowledging the invaluable groundwork laid by various groups is so key, and I heard Dr. Davila do that as well in this work. Organizations and professionals in the field of substance use is crucial as it's paved the way for the realization of this project. And so I want to share with you some key milestones along the way that are highlighted. And that started it started before this, but most recently in 2012, which isn't so recent, through the Emergency Room Alliance, where they identified the need for alternatives to an emergency department response and understood that many people were using services like the Gerstein Crisis Center, but that the capacity level wasn't where it needed to be to really be a sustainable alternative, and we needed to build that. We also had the Substance Use Crisis Project that encompassed 2 research initiatives, because we already have a substance use crisis team that operates within the city, but not funded with beds or in a fully comprehensive way. And we have seen through these 2 research projects, one through CRICH, through St. Michael's, and as well through a peer-based evaluation team out of Working for Change, that the approach is very effective. But it is not scaled at the level it needs to be able to meet the needs in our community. The Toronto Drug Strategy, the Toronto Public Health, and the Board of Health have all identified and championed the importance of this community-based, purpose-built substance use crisis center in Toronto, and we're doing it again today, so I thank you for that. And then many community organizations have also actively advocated and collaborated to provide harm reduction and crisis services that do provide community-based supports that are low barrier, trauma-informed, concurrent capable for all people, including those who use substances. So all these findings over the years have highlighted the need for a substance use crisis center. I'm going to change slides. The challenge existed for a long time, but has been exacerbated, the needs in our community in relationship to this kind of support. And that includes an increasingly uncertain drug supply, an upsurge in overdoses, and a decrease in service capacity to address substance use concerns. I know through COVID we had a very difficult time accessing services. It remains the same. The needs really outstrip the actual resources that are available. The average monthly drug-related death rate in Toronto has increased from 42 to 73 since 2019, and that highlights this escalating severity of the overdose crisis. Overdose deaths have had disproportionate impact on people who are experiencing homelessness. The work that we are doing through the Downtown East Toronto Ontario Health Team is part of a homelessness initiative as we're looking at that. And issues of inequity were further exposed and highlighted a need to be explicit in the need for equity and anti-racism in responses needed to be built into this as we move forward. So the crisis support to people who use substance working group has engaged in consultations with people who use substances, addiction medicine doctors, harm reduction providers, and frontline workers to understand the scope of the problem and gaps that can be filled and addressed. So we want to offer crisis assistance to individuals without overwhelming emergency services, police, paramedics, the emergency departments, to offer upstream health and social services, including harm reduction services, withdrawal management, evidence-based treatment, and supportive housing, and to offer purpose-built, community-based response to substance use crisis and integrated pathways to connect individuals to a wide range of ongoing supports as needed. So we go to the next slide. Whoever's on the next slide, we could go to the next slide. It'll come soon. There we go. So this is just an image that we have to sort of put the whole idea of what we're hoping to do into one slide, where you could see the crisis center in the middle. You see the overarching goal at the top, which is to provide timely and appropriate and respectful response to individuals in crisis related to substance use and mental health, which would reduce strain on first responders and emergency departments and improve client experience and lead to positive outcomes for the individual and the community. We're looking at adults 16 and over in this particular instance, and obviously looking at folks who may have intersectional kinds of needs, including homelessness, mental health, and other physical and social issues that could be at play. On the left-hand side, you'll see the multiple access points that we're going to try and achieve. We believe that wherever somebody is, that they get access to the supports they need. So you'll see from a 24-hour telephone crisis line, walk-ins at Respite and Stabilization Center to be able to just walk in, emergency services, paramedics linking our service to those services, withdrawal management services, existing and emerging crisis responses that are across the city, and community service providers. So we also would add to that list peer responses in the community so that, trust can be built to be able to access services, because we know many people do not reach out due to the past experiences around stigma. Within the crisis service, you'll see in the middle, we've got the telephone and mobile crisis response. We've got the respite and stabilization, which is initially when somebody were to come in and needed some kind of additional supports related to the substance use. That could include some addiction medicine. It may just include, close monitoring and some rest and peace for them to be able to recover. And then we have the short-term residential crisis beds as well associated there, where people could stay for longer periods of time. And within all of that, we're talking about including overdose prevention and response would be part of the crisis service, some of it located within the house, but also really strong connections to those services in the surrounding area so that we build pathways for people as they come through the crisis service. And then ultimately, all the post-crisis referrals that are needed, which include a full array of some of the things that have been mentioned here today, including reconnecting to existing services people may have already been accessing and have become disconnected from, housing and case management, other community agencies, recovery-based programming, counseling, safe supply and treatment, family doctors and psychiatrists, and as well hospital when that is what's needed. So the idea is to really be able to be where people are when they need it, and in an accessible way that allows them to reach out and feel safe to do so, and then be able to provide them to the immediate supports they need in that moment, but beyond that as well to existing services beyond that. So thank you very much.
So thank you, Susan, and thank you again, Dr. McKenzie. That was quite a bit of presentation for the board, but I'm hoping that you'll see that there is quite a bit of work already underway to start advancing the initiatives outlined in the Our Health, Our City strategy. It is, as you just heard, a very, very comprehensive and very ambitious plan for the entire city of Toronto, one that aims to build a sense of urgency, momentum, and unity as we seek to tackle some of the most complex health issues facing our city. So with that, Chair, I will turn it back to you. Just a reminder, we're hoping that perhaps this is the opportunity for the board to ask questions of our guests who have limited time with us today, and then we can go back presumably to the regular schedule. Thank you very much.
Thank you. And again, I'm going to extend my thanks to Dr. McKenzie, Ms. Davies, and Director Chandra Sekera for a great presentation here today. But before we go to questions of the board, I'm going to read the drug toxicity crisis acknowledgement, which I think would be appropriate at this time. The City of Toronto acknowledges the tragic and substantial losses of that people continue to face due to the ongoing drug toxicity crisis. These losses and the grief experienced are immeasurable. We acknowledge that this crisis is rooted in systemic discrimination. People who use drugs often experience stigma and multiple intersecting forms of discrimination, including racism, sexism, and colonialism. Many of us are mourning individually and collectively. In this document, we present data related to the crisis with respect and a heavy appreciation for what they mean and how they refer to our loved ones, friends, families, and colleagues. Okay, back to the board. Any questions of the presenters? Dr. Zhao?
Thank you for your presentation. This first question is for Susan Davis. Thank you for all the work that you do at the Gerstein Crisis Center. I just wanted to know, what is the capacity of these 24/7 crisis centers? Because I know on the slide it said there are 10 beds, but the need is definitely much greater. I certainly have many patients who are facing withdrawal, and we end up sending them to the emergency, especially in not the downtown catchment area, right? So I was just wondering, in terms of just the steps in which if a patient comes in with withdrawal, overdose, they can call the Gerstein Crisis Center, and how quickly would they be able to be offered a bed?
Yeah. So I think there's a number of ways people may connect with Gerstein Crisis Center right now in terms of accessing supports around substance use needs. And some people may be looking for withdrawal, and what we would do in that instance is connect with them and help them connect to with withdrawal services. But others may not be looking for that. They may be having difficulties associated with their substance use that don't necessarily lead to a need for withdrawal particularly. They may be continuing to use, they may have other factors that are at play that may not relate to their substance use, but are still really impactful for them in that moment. So there's a wide range of the ways people will present who are using substances in terms of crisis and what that can look like. So we have a telephone crisis line where people can call in and speak to somebody over the phone. And from there, typically, so a lot of the calls do resolve. I think we take about 30,000 calls in a year, and most of those calls do resolve over the phone. But some of them also result in a mobile visit that goes out to see the person in the community. And I think last year, I think it was close to 7,000 visits in the community through all our teams that went out and met with people. And at that point, it's a matter of helping that individual to identify what's going on, really listening to them, hearing what it is they say their needs are, and then working to try and address those needs. So at that point, that could include a wide range of things. It may include not connecting to anything, but really just speaking to the crisis workers. But included at that juncture would be access to a crisis bed if one's available. So we have our short stay beds, which are 3 to 5 days. And we also have there's 10 of those for the city. And then we have 6 substance use crisis beds that are located for men at the Ossington Withdrawal Management that's now run through St. Michael's Hospital. And people can stay in those beds for up to 30 days. So those are the beds that we have at the moment. We know we need more. It's always in demand. It's a major problem that we don't have more crisis beds. It's great that we are building an infrastructure now in the city that can respond to the immediate crisis, but crisis beds needs to be part of that. So we'd love to see that expansion as our teams grow.
And when someone calls the crisis center, are you able to also know where there are beds available? How long until they will be available as well? Is that data tracked?
Are we able to know? Say that again?
Are you able to know how many available beds there are across the city, and when they will become available? How many days is the wait time?
Yeah. So we have a number of beds that we operate in the city, that we know exactly who's in and what we have available to us, and we work across all our teams to try and make those available to whoever is presenting in that moment. We don't typically carry a wait list. The thing about crisis services is that their flow through. If they aren't, then you don't have crisis services. So if somebody's in need of a bed and we don't have one, we're going to look for an alternative to try and set them up for that moment, as opposed to sort of setting it up for 3 days from now, because it's not the planning. That's not the way it works for crisis. So you want to be able to deal with it in the immediate, and that's how that would happen. So yes.
Great, thank you.
We do know where beds are available, but then there's other beds that we call and we have access points for, but they're not all in one dashboard.
Yeah, and I'm just watching my time here. One other question is for Upala. I know that decriminalization wasn't discussed in today's presentation, but when I read through the updated drug strategy, I was just wondering if there are going to be any additional metrics or information about the decriminalization process. For example, whether there's going to be a threshold set for amount of drugs in possession for personal use versus for trafficking. Will there be metrics as to whether decriminalization results in how much decrease in overdose or increase in overdose, things like that?
Thank you for the question. Through the chair, even though I didn't discuss it today, decriminalization is part of our health, our city. You will find that under Goal 4. With regards to the monitoring and implementation and the annual reporting back, I think one of the key ways to measure that is the amount of charges that are laid by Toronto Police Service. And right now, Toronto Police Service is operating under de facto decriminalization. So when you actually look at their data, it's actually a very limited amount of charges that they're actually laying with regards to possession charges. And so that will be one of the metrics that we use in the reporting back annually.
Definitely. And for sure, one of the, I think even more important than the number of charges is looking at a decrease in overdose, because it's not just to eliminate the stigma around criminalization, but also more importantly, to eliminate the overdose deaths or number of people who use drugs, for instance.
Absolutely. I think it's really important for us to remember that decriminalization is one point in a very, very large plan. We need all of the services, the clinical services in place in order to effectively affect that change. And so for us, the Toronto Overdose Information System, monthly we update that. We receive data both from the coroner's office and also from our colleagues at Toronto Paramedic Services, and that we are continuously monitoring the rates of fatal and non-fatal occurrences in our city.
Thank you. And sorry, just one last thing to clarify is currently we don't know yet what that threshold is going to be for. So for example, in Vancouver, that threshold is 2.5 grams of fentanyl, for instance. Do we kind of know like that standard for the Toronto strategy?
Our updated submission to Health Canada in March of this year had no threshold.
Okay, thanks.
Thank you. Councilor Thompson?
Thank you very much, Mr. Chair, and excuse my voice. Good morning, and thank you so much for the excellent presentation. Ms. Davis, I wonder if I can just start with you. With respect to the service offering 24/7, the interaction with respect to many people who are facing mental health crisis in a community and at varying places in the city, generally, often the first call is made to the police. How is your organization interacting and working with the police to help to facilitate the type of response that we so desperately need?
Yeah, so I mean, it's a really interesting question, and I think it is the perception that typically people who are living with substance use or mental health concerns are going to call the police when they don't know where else to call. But typically, the calls going into the police are for people who...
I'm sorry, I wasn't specifically suggesting that individuals are calling the police, but broadly,
Right.
For example, a situation, a shopkeeper,
Yes.
someone enter,
Yeah.
they generally call the police, not your group as a first responder.
Yeah.
Just wondering, how do we create that interface
Yeah.
in order to minimize the potential impact of an Anjuluku, for example?
Yeah. Absolutely, and thank you for that question. It's a very important one. I mean, the Toronto Community Crisis Service is connected to municipal services so that we can divert calls that come into 911 to a crisis response. Gerstein Crisis Center also has crisis workers co-located at communications at 911, so sitting alongside the responders to be able to divert calls at that source, and it's about to go through an evaluation. We've been able to divert many calls through that project as well. The other project that's interesting and not part of all of this, but is still funded through the city, is our Here to Help project, which is crisis workers combined with other workers through other services in the downtown east, in particular the Church Street corridor and Moss Park, which is specifically designed for shopkeepers to be able to call that team instead of the police. It's been highly successful, and I think the feedback overall from the community is that they're very grateful to have somewhere else to call. They find they get a more appropriate response that results in greater outcomes for the people who are involved. So There's a few strategies that we have in place that we're working on, but they're small in terms of how do we make that happen on a larger scale. TCCS is the strongest, tool we have right now for diversion.
Thank you. My office, we've just completed a report which we showed to Dr. Davila on mental health issues. And some of the findings, obviously, that you reported here as part of the presentation is very much in sync in terms of our understanding. But what I want to, not so much the status, but I wanted to understand is whether or not we break this down from the ward-specific analysis.
So, yeah, anyone. So thanks very much for the question. We've had a few meetings of the report card, and part of the aim of the report card, and we did discuss the idea of a ward-by-ward analysis to be able to give councillors the information they need at ward level as well as at Toronto level.
Board, we found that a very large number, which the report has, the presentation here today, has suggested that young people who are greatly impacted. One of the things that we discovered, though, that there was a bit of a disconnect with respect to the schools themselves and the board in terms of their area of focus and responsibility, because the assumption is just that it's a city problem, it's a City of Toronto problem, but as you pointed out, as part of your presentation, it's everyone's problem. It's a complex issue. I'm just wondering, with respect to the conversations you've had with the board, how have they received the communication? I'm not sure what that is.
I have no idea. Is everyone on mute online? Please double check. Thank you. Yeah, go ahead.
How the school boards are reacting. And then finally, as part of my question, I'd like to understand, you talked, Dr. McKenzie, about 400,000 people who have had no family or friends to be able to reach out. We have found that in my ward specifically, in the document that we prepared, a similar situation, and we're looking at ways to be able to connect people, similar to what we did in 2015 when we had the ice storms. We were able to set up some mechanism in my ward to be able to connect and provide people with services and so on. So I'm wondering what's being done with that, and what is the opportunity of using AI and or technology to actually help us be able to create a better opportunity with respect to impact and outcome for residents in their city.
Why don't I begin with your question around students? And so through the chair, thank you for that question. Oh, sorry. We absolutely, the Toronto District School Board and other school boards in the city are a major partner, and we've identified them as an important key implementation partner for the strategy. So currently, Toronto Public Health, under the leadership of our Chief Nursing Officer, Nicole Welsh, we do have a school health program in which mental health promotion is provided in the school setting.
The 400,000 people, the lonely people who are in need of some connection and
At the moment, a direct focus on dealing with the loneliness issue is not something that Thrive is looking at. It may be something that the city is looking at. And it is an important factor. And I noticed that we've got loneliness experts, by the way, and connection experts such as Pete, who are, I don't know whether he's deputing or whatever. So there are people who are working on this. Note, however, in the UK, they have they actually have a minister for loneliness, which is taking it to a whole different level because they can see the impact of loneliness. I don't know whether you saw the WHO, the World Health Organization report.
we did.
Yeah, 15 cigarettes a day is the impact of loneliness.
Right.
So it's something that we need to be thinking.
Which is another health issue altogether.
Yeah.
Absolutely. Okay. Thank you, Mr. Chair. Those are my questions. Thank you very much.
Thank you. Deputy Mayor Malik?
Thank you very much. Thank you for the presentation and all of the hard work on this important strategy, this life-saving strategy. And I wanted to talk about the implementation piece. Dr. McKenzie mentioned it. It's a really important aspect of moving this strategy forward. Recommendation 2 in particular is about setting up an implementation panel. And I'd like to hear from each of you how you see the role of the implementation panel in furthering us along the strategy and being a critical accountability mechanism.
Thank you, Deputy Mayor, for that question through the chair. We would love to work with the board to establish a very public process for this implementation panel. I think there's so many stakeholders, so many people who are touched by mental health and substance use, and so many people that we spoke to over the last year and a half who want to support the implementation of this important strategy. So we would really love to work with the board to establish this panel and have a public, application or recruitment process so that everyone has an opportunity to have a seat at the table. And a big role for this implementation panel will be to look at all of the actions of the strategy. As we said at the outset, this is a very ambitious plan, ambitious goal for our city. And so we were really looking to the implementation panel to help us figure out, okay, we have our year 1 priorities. They're already priorities that the city has established and asked funding for. But what about year 2 and 3 and 4 and 5? It would be really great to have this panel guide us and support us in figuring out what should be the next set of priorities for year 2, guided by evidence as well. And we believe that it is vitally important to have people with lived and living experience of both mental health related issues and substance use related issues on this implementation panel. It is really important that the way in which we implement these recommendations are guided by the needs and requirements of individuals who are really experiencing this in the City of Toronto.
Okay.
Dr. McKenzie or Susan, is there anything to speak to on that?
I mean, where obviously Thrive is working lockstep with the city on our health, our city. Very happy to join an implementation panel. We obviously are getting on with the implementation of our own strategy, and so have already started work on the report card and other things. But we would much prefer that to be linked up to an implementation group for the city strategy, because, as I said before, it's always better when we're together.
I like the question about how do we take the plan and make it actionable and have accountability for it, and I think that's really important. And Upala's answer about making that publicly available so that people can see what's happening is so important as well. The needs have been so long established, and it's time for people to be able to see, what we're doing, and also to be able to influence that. So I really, I think it's a really important feature that I'm happy to see.
My second question is just about how our health in our city deals with recommendations that go across city divisions and to all levels of government. It's quite comprehensive in that way. And Dr. McKenzie mentioned, there are some things that really only the City of Toronto and Toronto Public Health can uniquely hold that have been uplifted in this report and strategy as well. So my question is just, being able to hear a little bit more about what you see as the role of Toronto Public Health and the Board of Health in ensuring this strategy is a success.
Again, thanks for the question. With regards to implementation, given some of the direction from the Board of Health already, we've established a interdivisional table, which is chaired by Paul Johnson, our city manager, and Dr. Davila, where many, many different division heads from across the city are sitting at that table. And so with regards to implementation, many of the city divisions had input into this strategy. And several of our colleagues are here. They're very excited to get moving on the actions that impact on their areas of responsibility. So that's a key mechanism for us at the City of Toronto in implementing this strategy. One of the things, as you may recall from the announcement of the strategy last Monday, the Chief People Officer, Mary Madigan Lee, made a very big commitment to implementing the national standard for psychological health and safety in the workplace as an employer at the City of Toronto. So we're very excited to support the People and Equity Division on that initiative. With regards to Toronto Public Health, as I mentioned earlier, there's a dedicated team, a mental health, harm reduction, substance use and treatment team that will be supporting that work. And we envision, not every single action in this strategy can be the responsibility of public health, but we want to be the supporters. We want to help convene stakeholders, advocate to government, and especially support the monitoring of the progress and tracking the progress on this strategy. So we envision the next 5 years working collaboratively with our city divisions on this.
Thank you, Deputy Mayor. Next is Councillor Perks.
Thank you. Upla, I'd like to just follow on some of the questions that Councillor Malik was asking. So the implementation panel, I'm just going to ask some questions about what you would see its work being. Would you agree with me that it's very important that its work be transparent, that it take place in full public view?
Thank you, Councillor Perks, for the question. I think that's something the panel will need to determine, because we know that especially having public meetings like this that involve people with living experience is challenging. As many of those individuals have shared with us, they share stories from their experience and don't necessarily feel comfortable in a very public setting like this. And so I think we will need to determine that with the panel, what level of transparency. However, I think that it's very important that there are regular reports that come from that panel to this board, so publicly we can understand the types of decisions and actions and advice that's being given with regards to the journey of implementation.
You kind of anticipated my next one. So you would see the panel as regularly giving updates to the Board of Health and informing the annual report on progress?
One of the recommendations outlined in the report to the board today says that we will come back within the first quarter of next year with a plan about the frequency of reporting, et cetera. So we welcome your advice on how often you'd like to hear from that panel, the frequency of meetings, what the composition of the panel should be with regards to numbers. So happy to have your advice on that.
Okay. And in a number of areas, some of the goals are quite high level. And I know in previous work we did with the implementation panel around the drug and alcohol strategy, an important role of that multi-sectoral, if you will, or multi-voice advice was to help us refine those goals, help make them more specific, help develop timelines with other partners and other orders of government. Would that be another piece that we should consider for the implementation panel?
Absolutely. There are no terms of reference yet for this implementation panel. So however the work we envision, I think there's lots of opportunity to co-create that.
And do you see also the panel as being a valuable tool in giving us accountability back to the communities we're serving?
Yes, absolutely. Please say more. How do you envision that?
Well, so by including a variety of people, so people in service delivery agencies, people who do advocacy work, people with lived and living experience, actually being members of that creates a mechanism for those people to be accountable back to their communities for the work we're collectively trying to do. Is that a kind of model that you think would be valuable?
I think that would be great. I think what would be really valuable is to have a public application process, because we've heard from lots of people, actually just with the launch last week, putting up their hands saying, I would love to be a part of that. So I think having a very clear set of criteria for how to apply and have a seat at the table would be very, very important.
Okay. I guess I'm giving you some of my feedback already. Okay. Thank you very much, Mr. Chair.
Thank you. Director Ozday?
Hello, can you hear me?
Yes, we can. Go ahead.
Beautiful. I just wanted to say thank you to Kwam, Susan, and Oprah for the beautiful presentation. And Kwam, good to see you again. And my question is actually directed to you. I know that stress has become a defining feature of living in a hyper-fast, hyper-connected, but as we've seen, hyper-isolated culture. I was reading the Toronto Vital Signs report, and there were some similar themes around, social isolation and loneliness. Um, but we also know that work, and to some extent, we are at work right now, is a significant source of stress. And I'm actually reading a book called Rest is Resistance that advocates that we all do something that we're not doing enough, which is to rest. And so, Kwame, my question is, you'd mentioned the employee assistance program going upstream versus being provided at the point of crisis to workers, and I agree with that. But I'm curious, any specific insights into how the conversations with employers will go?
Thanks very much for the question. The interesting thing is that the Mental Health Commission of Canada have been working with employers already around psychological safety at work and the sort of safe workplaces, psychologically safe workplaces, which the city has agreed to implement. So those conversations have already started. The Mental Health Commission of Canada have also worked with employers around developing EAP programs for people who get sick. How many sessions should there be? What should those sessions look like for people who get sick? So there's been a conversation already with various EAP providers and employers over time. And you'll know that 50 to 60% of Toronto employers say they want to do more for mental health of their workforce. So this is a conversation we're continuing, not starting. And it's building on other conversations that people have had, and Civic Action did a lot of work on the mentally safe, psychological safety in the workplace. And we're building on those conversations. And part of why we're building on those conversations is we're hoping that the idea of mental wellness and what the EAP programs can do to promote mental wellness will also get into a conversation about what a good job is. We've been doing work at the Wellesley about what a good job is, a good job for your health. And we'd also like to be thinking and having that conversation in the future with employers about how we can create jobs which work for people as opposed to jobs that only work for industry. Because actually, if you get jobs that work for people, they also work for industry in the long term. So those are conversations that are going to be ongoing. We don't know how they're going to go, but we've just started those.
Great. Thank you so much for that. And I believe you also mentioned the importance of having small wins, because obviously mental health is a big thing. The strategy is even a much bigger thing. And so again, with regards to the EAPs, we're coming towards the end of the year. The new 2024 is right around the corner. If you had to tell employers like one small thing they can do in the new year, what would it be to uplift their employees' mental health?
You're going to have to repeat the question because I didn't quite get the question.
So I said, with regards to your point on small wins, what do you think employers can do, say, by the new year to uplift their employees' mental health?
Your last question.
Wow, yeah, that's a, so yeah, last question, lucky. That's a big question. It is, obviously, it is different for different employers in different situations. I think that the first thing that employers can do to improve employees' mental health is to actually recognize that it is an issue, yeah, and to start the conversation. And we've actually seen when, with the psychological safety, the Mental Health Commission's psychological safety, is as soon as employers started talking about it, thinking about it, and then they used the tool to measure where their workplace was on the continuum of psychological safety, things got better. And so it is actually being open to the conversation, thinking about it, going and starting using the tools to see where you are, and to try and get some data on whether you're doing a good job or not. And employers who do that tend to build environments that are better for their workforce. So the fact that the city is deciding through Our Health, Our City to go down that route is really important. And the fact that they've signaled that they're interested in doing that is going to make a difference to the mental health of employees.
Yeah, thank you. Councillor Bravo?
Thank you, Chair. I'll start with just a brief question to the Director of Public Health. We have a strategic planning process that we're initiating, and will be chairing that committee, that subcommittee of the Board of Health. I think is it fair to say that this strategy will be certainly part of considering what the strategic objectives will be and directions for the next period in Toronto Public Health. Is that safe to say?
I hope Dr. Davila doesn't mind me answering on her behalf. Absolutely. I think we've put so much energy and there's been so much consultation in the co-creation of this strategy that we hope that it will be a key pillar in Toronto Public Health Strategic Plan. Yes.
And certainly many, I guess, implementation questions and resourcing come out of when you have a strategic plan that makes this a priority. So thank you. Many questions that I had have been asked by other directors here, but I really wanted to focus on children. Children are living collectively, so the loneliness element doesn't apply to them in the same way. Children are as young as 7 who are harming themselves, and the primary challenge there isn't actually substance use or abuse. But when we hear a statistic like 20% are harm themselves, 6 out of 10 are depressed about climate, I just want to see if there's any thought or if you have any comments to make around how the economic crisis that the families are facing, in addition to pressures, existential pressures like climate, experiences of discrimination, racism, for example, when we haven't, children seeing their parents worried about buying food and paying the rent. What kind of focus do we need to make on this? Because what it feels to me, from the information you've shared, but also from the work that I do in the community, that this is a tsunami that's hitting us of proportions that we have not grappled with when we have children 7 up to, into their early 20s, young people who are struggling so profoundly with mental health challenges.
Lovely to see you again. And I would agree with you that there are significant problems, and they're predictable problems. In the United States, they call it a pair of ACEs. The first ACE is adverse childhood experiences, and the second is adverse community environments. And if you add adverse childhood experiences to adverse community environments, you predictably get problems in teenage and adult life. And all of the things that you talked about, financial insecurity, offending in the family, substance use in the family, poor housing, all of those things are things that increase and significantly increase the risk of both mental health problems and substance misuse problems in the future. And one of the reasons why we wanted to have a report card was not just to measure the negative mental health outcomes, but to also be able to measure these adverse childhood experiences, shine a light on them, and therefore hope that that will help lever policy change, because it is an area that we need to be thinking about if we really want to deal with this. Because I love what the Gerstein are doing, and I do believe that we need better services and we need more services. We really do need that. But I'm one of the few doctors who you're going to meet who wants to put himself out of business. You know, I want to move upstream. I don't want to see people, really. I want people to be well. So we have to do that, but we also have to move upstream.
If I may, Mr. Chair, it is significant, and I do want to point that out for the board. It is rare that we hear a clinician speak as much about moving upstream as you do, Dr. McKenzie, so thank you for that. That's the bread and butter of public health. That's where we're constantly advocating. And, you know, as important as treatment is in those moments of crisis, we know the real power actually rests in preventive work. Hence, you'll notice in the strategy throughout, it is always about prevention wherever possible. This is the fundamental of public health practice.
Okay.
Just to add my voice to that, is Gerstein Crisis Center would fully agree with that as well. We really would like to see less crisis services if we could, but not in the current climate, but absolutely for the future.
Thank you. In the interest of time, I'll ask one loaded question. And I'll devil advocates here. So the city have committed to some of these strategies already. For example, the 24/7 crisis center support through Gerstein, for example, and Taibu and others, which is great. But some of the recommendations here are also dependent on the province. And one of the questions that have been asked time and time again since we made this announcement last week was, what if the province doesn't come forward? How would this impact the strategy in the long term?
Thank you, Chair, for that question. A lot of these initiatives can be managed well with existing resources. Certainly, there's no one number of financial request attached. But others, we absolutely need and trust that the province will come forward, and the feds as well. So, for example, the expansion of the Toronto Community Crisis Service across the entire city requires that level of support. The amount of supportive housing that we need for the city, Dr. McKenzie referenced the supportive housing growth plan for the city. It absolutely needs resources and support beyond the city of Toronto. So we trust that the province and the federal government will come forward to support us.
Thank you. Short and sweet. That's the way I like it. So again, thank you, Dr. McKenzie, Ms. Davies, and Director of Public Health, Chandra Sakaraka. You know, I always get that. Anyways, Chandra Sikara. I do not just say it, right? It gets twisted in my head and then I get all screwed up. Anyways, thank you so much. And we will now go to speakers. Deputants. Okay, thank you. Is MPP Kristen Wong-Tam on the line? Okay. All right. So our first deputant is Michael Ann Horn, Chief Executive Officer for Canadian Mental Health Association, Toronto branch. Are you here? He's online. Okay. You have 5 minutes to depute to the board.
Good morning, and thank you very much. I really deeply appreciate the opportunity to speak to the Board of the Health on Our Health, Our City. Canadian Mental Health Association was consulted as part of the development of this strategy, both as our own organization and as part of the Thrive Toronto table. And I also want to commend the Toronto Public Health staff for their deep involvement of people with lived and living experience of both mental health and substance use health concerns. That's vitally important for these kind of plans. And CMHA Toronto fully supports the adoption of this plan and will work to support its implementation because we're working towards all Torontonians living more mentally healthy lives, regardless of where they are in the mental health and substance use health continuum. And this plan will help the broad coalition of people working to realize similar visions. Our organization is one of the city's leading community mental health agencies, and we work every day to provide services and programs to promote recovery and encourage positive mental health. We work with people across the entire mental health continuum. We operate, excuse me, we operate in over 20 sites across the city, and we serve more than 15,000 individuals each year. And in our work with people with severe mental illness, we work to integrate primary care, clinical mental health care, and social care around the social determinants of health, which we've heard about so much this morning, to improve the ability of our clients to thrive in community. In our work, we witness the impacts of the deep inequities related to mental health and substance use health every single day. These inequities are strongly connected to the social determinants of health, including income, access to housing, employment, sense of belonging to community, and other social and economic conditions which impact all of our lives every day. We deeply appreciate this strategy's acknowledgement of the complex and inseparable interplay between the social determinants of health and mental health and substance use health concerns. We also love that this plan recommends that all of these issues be addressed together. Increasing access to the social determinants of health is essential for positive health and substance use health. In particular, income, housing, and social belonging, and in social belonging, we include the impacts of racism and colonialization, are crucial issues for our city and for improving the mental health and substance use health of all. We applaud the plan for identifying access to housing and other determinants of health as a key goal. We appreciate that this strategy also offers recommendations to strengthen the mental well-being of our city across the lifespan and acknowledges that both mental health and substance use health are on a continuum. We also applaud the plan's bold approach to integrate mental health and substance use health into one plan. Although these concerns can exist in isolation, they also often interplay with each other. And I do want to repeat, they don't always interplay with one another, but they can. Both are also significantly impacted by the social determinants of health, and both are highly stigmatized, although I will say substance use health is much more stigmatized. Until we end the stigma related to both, people will continue to avoid seeking help early, and so will increasingly and continually encounter crises. We know that substance use in Canada has increased since the pandemic, and we know that with the deepening drug poisoning crisis, we've seen an increase in overdoses. So the recommendations made in this plan to prevent and reduce the harms related to substance use, as well as to enhancing harm reduction and treatments, will go a long ways to save lives.
Are you?
So I would also like to acknowledge that we are one of the anchor agencies of the Toronto Community Crisis Service, and we want to celebrate the City of Toronto for initiating this service and hopefully for expanding it in the near future. This service has been vital in integrating community care, mental health care, and addressing mental health crises with mental health workers. In closing, I'd like to endorse our city, our health, as a comprehensive strategy to strengthen the mental health, substance use health, and well-being of our city. And CMHA looks forward to working with the city and Toronto Public Health to implement the plan.
Thank you. Thank you. Any questions for the deputants? Seeing none, thank you for coming in today. Next on our list is Joanne Simons, from Casey House. You have 5 minutes to present to the board.
Good morning. Can you hear me? Yes.
We can.
I'm normally loud without a microphone. So thank you for the opportunity to share insights on behalf of Casey House. And I want to express my appreciation for the commendable efforts of public health and the city in developing a much needed response for some of the most deserving individuals in our community. My sincere gratitude to Board Chair Moyes, Dr. de Davila, and the entire public health team for their thoughtful and inclusive approach to the strategy's development. For those unfamiliar with Casey House, we are a specialized hospital that is committed to serving people living with HIV and those from communities experiencing higher rates of the virus. Our focus extends to those for whom systemic inequities and trauma have a profound impact on their lives. The Our Health, Our City strategy offers direct solutions to support the population we serve while actively working to dismantle racism, homophobia, transphobia, and discrimination. I'd like to draw attention to Goal 2A, Bullet 3, which specifically addresses the need for supervised inhalation services. As the only Health Canada approved inhalation site in the province, I'd like to share some data illustrating the trends that we have observed. Casey House's inhalation site is not a public site. It is for active patients within the hospital, both on our inpatient unit and our outpatient clinic. We opened up the inhalation site in November of 2022, so we've been open now for almost exactly a year. And we opened it based on feedback from our patients, indicating a strong preference for inhalation over injection. The SES at Casey House is considered like any other health service. The same nurse providing wound care, STI testing, Hep C treatment can also provide education on safer use and harm reduction. Inhalation usage rapidly became the most popular choice within the SES. Over 50% of the SES visits went from injection to inhalation, reaching 75% by the 6th month, and those trends have continued. The addition of inhalation services has resulted in doubling the number of patients we've seen within the SES, new patients to the hospital, catering to a broader spectrum of individuals using drugs. We've had, obviously, like everywhere, a high rate of overdose within the SES. Our team has only had to call EMS once during the period of time that we've been open the past number of years, and that was only related to a benzo contamination of the drug supply. We haven't had to engage with law enforcement due to any interactions within the SES, which both highlights our ability to train our teams to be able to manage situations acting as frontline workers. It's reducing the burden on paramedics, on emergency departments, and Toronto Police Services. And I know that there is a lot of work, and some of our TPS colleagues are here today, to decrease the criminalization of people who use drugs and those living with HIV, but that fear is very real. So whenever possible, we work with our team to manage any situation that may occur. In addition, this new option of inhalation is connecting more people with healthcare. So that doubling of the patients that we're seeing within the hospital who are new to Casey House, when they're accessing the inhalation services, they've been a bit sporadic at times, but we've observed as we've built relationships that newly registered patients are transitioning from the sporadic visits to becoming daily attendees, actively seeking care from our nurses, mental health clinicians, and extended team. Harm reduction and mental health services play a crucial role in safeguarding the health of our city, our communities, and the individuals who use drugs. It's essential to recognize that people who use drugs are not a threat to our city. The real danger lies in the stigmatizing, the portraying of them as undeserving of fair and equitable health care. The Our Health, Our City strategy represents a significant stride towards ensuring that every member of our community is acknowledged for their humanity rather than being defined solely by their health condition. And I sincerely hope that funding from all levels of government materializes to transform this vision into a tangible reality. This investment is not just in harm reduction and mental health, it's an investment in the well-being, dignity, and inclusivity of our entire community. Thank you.
Thank you so much. Any questions for the deputant? Okay. Seeing none, thank you so much for coming in today. Next up is MPP Wong Tam, Toronto Centre. I think you're online. Okay, you have 5 minutes to depute to the board.
Yes, thank you very much, Speaker and Chair. It's very nice to join everyone here online today. I want to start my remarks by just saying that my name is Kristen Wong Tam, former board member of the Board of Health, as well as the City Councillor, and now the current MPP for Toronto Centre. It should be commended, and every single one of you who are sitting here at the Board of Health leadership table, as well as Dr. Davila and Director Upala Sakara, should be commended for their extraordinary leadership in shepherding this report forward. I want to thank you, Chair, in your capacity as the leader of the Board of Health for the ongoing work that you do to ensure that Torontonians are safe and healthy. Along with that, I want to extend my thanks to Deputy Mayor Morley as well as Mayor Chow. I'm here to share my absolute support for the City of Toronto's new visionary initiative, this strategy called Our Health, Our City, a mental health, substance use, harm reduction, and treatment strategy for the city. This is an imperative strategy that underscores the city's unwavering commitment to combat substance use related harms, and at the same time, altogether nurturing mental health and the well-being of every Toronto resident. This report is an outcome of a City Council motion I moved back in November 2021. At that point in time, it was seconded by Mayor Tory. We directed the Medical Officer of Health to pull together all the different strategies that the city had to come up with one comprehensive mental health and addiction strategy. It was to become a blueprint to create, name, and design community-centered services and programs that would serve and support the mental health and well-being and safety of all Torontonians. The catalyst for this motion was actually a strategy that was grounded in conversations I had with downtown business improvement associations, residents associations, as well as supportive housing providers, mental health and community health providers, including conducting 5 healthy neighborhood summits, all as I was working in Ward 13. What was a common theme that was thread throughout every conversation was the fact that there was an inadequate amount of mental health support and funding coming from both the provincial and federal government. This was a message that was then reinforced by Mayor Nenshi when I asked him why he personally chose, Mayor Nenshi of Calgary, why he personally chose to create a mental health strategy for his city, the very first one of its kind in Canada. I then challenged him to explain why would a city undertake the creation of the mental health and addiction strategy when clearly many of those services and programs fall directly under the purview of provincial and federal governments. Mayor Nenshi astutely explained that Alberta's Conservative government have slipped away from supporting and funding mental health and addiction services, and that by creating a city-based strategy that clearly put into sharp focus what the city's needs were is actually absolutely critical in compelling the provincial and federal governments to fund mental health services in the cities and in the regions and in the province, but also to ask them to come to the table in a partnership manner that will allow them to better coordinate those services from a region and province-wide perspective. It also allowed his city to then put into sharp focus what the city can do when it comes to mental health and addictions, with respect to prioritizing funding and access and supports through public health, community-based recreation, social development, city planning, housing, and other services for low-income and homeless individuals. All of those services lead to better health outcomes and better mental health outcomes for city residents. Mayor Nenshi then confirmed what I've learned now in my time at City Council, is that if a municipal's plan is well-researched, documented, and it has broad stakeholder engagement and consultation, and it produces realistic, strategic, and specific implementation outcomes, then you are going to have better success and resource for success in bringing the provincial and federal governments to order. And to that effect, I want to thank everybody who worked on this strategy, because you have done exactly that. You have outlined what the city's responsibility is, what the provincial responsibility and federal responsibilities are, and I'm hoping that I could help you champion your report at Queen's Park. It is absolutely important and imperative that the province comes to the table. Otherwise, the strategy will not have the pathway to success that it deserves and that Torontonians deserve. And of course, we all know that the matter is very urgent. We are all seeing the statistics, and we want to thank the Director of Health, as well as the Medical Office of Health, for those presentations that led up to the opportunity for deputation. Advocates and social service supporters, community members have led by the Canadian Mental Health Association, have ardently implored the federal government to come up with a national mental health funding parity strategy, meaning that for every $1 invested in public physical health, you should have a corresponding $1 in mental health. And so I would implore you to continue the advocacy, ensure that it extends to the province, and I will be there to support you every step of the way. Thank you very much for the opportunity to speak. I conclude my remarks here and welcome any questions if there are any.
Thank you for coming in. Any questions for the deputant? Seeing none, thank you so much for coming in today. Have a good afternoon.
My pleasure, Chair. Thank you.
Next up is Roderick Main, South Riverdale Community Health Center. Are you here? You have 5 minutes to present to the board. Go ahead.
Okay, can you hear me?
No. Yep.
Can you hear me?
Yeah, I can, yes.
All right. As a peer support worker, I have lived experience in both criminal justice system and harm reduction community. Due to my professional and personal experience, unfortunately, I lost my brother to an overdose. If I knew what I knew now back then, he'd still be alive today. I've spent many long, cold nights helping community members in the streets, reversing overdoses when all the sites were closed in Toronto at night. I have a lot of personal drive to help people so they don't have to go through the loss and grief that I had to go through. I have a lot to share in the terms of crisis, de-escalation, overdose recognition, response, and client navigation, and group and one-on-one facilitation. With great communication and decision-making skills, I understand the importance of informal, on-the-spot counseling that can happen in moments when a person is feeling vulnerable or scared. Over my many years of working in the harm reduction community, after listening to many of my peers' opinions, I would strongly recommend that there be a 24-hour supervised consumption site in Toronto, as well as a crisis stabilization center for people with mental health and substance use issues. The most effective way to make these services accessible to those in need would be by placing these sites where the greatest demand is apparent, based on studies done by community health organizations, which track the percentage of the population that engages in illicit drug use. These sites would be the best run by allied health workers and consist both of healthcare professionals and people with lived experiences, i.e. nurses, overdose response workers, peer workers, support workers, and clients from across the city. What I've learned from evidence-based substance use treatment programs, such as case management programs, rapid access addiction medicine clinics, long-term care, inpatient hospital programming, is that there is a great need for these types of programs to be expanded. Programming should be inclusive of more opportunities for people with lived and living experiences so that they may better able to secure leadership opportunities with equal wages to those who have gone to school. Adding evening and weekend programs at non-residential treatment programs and adding more staff to withdrawal management programs, a Big Brother type of program for outpatient clients for any recovering addicts that wish to reintegrate into the mainstream society by way of exposure through engaging in outings and activities with a mentor that resemble those of a person with a more stable and functional lifestyle. Permanently funding drug checking services, including mass spectrometry, explore options to increase drug checking access points, rapid drug testing technology at the home, drug testing options. This is very widely needed in the community due to a high level of toxicity in the drugs these days. It is imperative that people are able to test their drugs before they use them, as opposed to testing them and having them used before they even get the results back. The last one is decrease the criminalization associated with mental health and/or substance use issues through providing more options and alternative crisis response. I believe that jail doesn't help fix people. Jail makes people bitter and angry, as well as more likely to reoffend due to the fact that their ability to exercise their decision-making process, a process that would be allow them to develop the skills that are needed to make good decisions, has been taken away from them for the duration of time that they spend behind bars. The fact is that people don't need jail. People need treatment for the issues that they have, which sit at the root of the problems that they cause. When those are addressed, then the problems they cause can be eliminated. Overall, if we could focus on less on punishment and more on treatment and daily living programs, as well as more access to 24-hour harm reduction services, we could lower the incidence of death due to drug use. We could also decrease admissions to jails, hospitals for issues related to mental health disorders, which in turn would allow us to reach our goal of making Toronto a safer place for all Torontonians to live.
Thank you so much for coming in today and sharing with the board. Any questions for the deputant? Seeing none, thank you for sharing.
Thank you.
It's appreciated. Brian Clark, you have 5 minutes to present to the board.
Good morning, everybody.
Morning.
Let me find my spot here. All right. I arrived in Toronto on November 17th, 2022. I was running from troubles in Barrie. I was homeless, addicted, and using on the streets of Toronto. It wasn't until April 2023 did I find Moss Park Consumption Site. This is where I met Sarah and her team of professionals. It was like no other experience in injection sites. They treated me like family. All of a sudden, it was like somebody actually cared. With this new circle of influence, which was geared to meet my needs, I could start to see a better way. I had been clean from fentanyl and meth for just under 4 months. I now have my own apartment, and I still go back to the site to volunteer my time giving haircuts to the homeless and addicted. I have been able to confide with staff and become a part of their mission to save lives and create a new path of any kind of positive change. I stand in front of you today with my friends, my family of Moss Park Consumption Site behind me, doing what we do because we are experiencing results. People who are struggling can finally feel accepted for their struggles. This understanding sure gave me a chance to grow up faster than anything in my past. Nobody is holding me back. I am only pushed further into sobriety by encouragement and no past judgments. Trust and support is a big thing, and to have more funding and 24-hour service would allow clients, staff, and our community to alleviate a number of issues such as crime, drug possession charges, ambulance 911 calls, best of all, pain and suffering, and ultimately death. Safety and well-being for everyone is a huge conversation. Also, this is why I'm standing here today. After overdosing under the care of staff, I was cared for and given resources to never let it happen again. I love the compassion, and it goes a long way. That's why so many of us, and most of us, are here today. When I was asked to speak about today and my journey, I had a jolt of excitement but full of nerves. I couldn't pass. Over 140 convictions across Canada, 13 years incarceration, broken promises, dreams, relationships crumbled, and death all around me. I can now persevere and create a new positive change from tools and experience I have encountered working with Moss Park Consumption Site. My future is looking a lot brighter today. I have a new passion that is rewarding in ways I can't explain. But for yourself to get involved and say yes to all the needs of our community, it will empower you, the addicted, and maybe even the small crowd that is against us. I hope as a whole that we can go the extra mile this time around, and we together can reach the strategic goals and recommended actions set forth today. Let's keep an open mind and use our hearts as a moral compass to make the right choices today. And let's all at once think bigger and not settle for less. Thank you.
Thank you, Brian. Any questions from the committee, from the board? Seeing none, thank you so much for coming in today and sharing your testimony.
Thank
you. Rosalind Shields, Senior Policy Analyst, Toronto for Addictions and Mental Health. You're online, I was just told. You have 5
Thank
minutes. You. Go ahead. You have 5 minutes to present to the board. Go ahead.
Great. Thank you so much. My name is Rosalind Shields, and I'm a Senior Policy Analyst at CAMH. And on behalf of CAMH, I want to offer our congratulations and support for Our Health, Our City, a mental health, substance use, harm reduction, and treatment strategy for Toronto. As you know, Toronto is in the midst of a mental health and substance use crisis that is being compounded by poverty, homelessness, and the toxic drug supply. Every day, we see this crisis play out in our streets, parks, and public transit. Community agencies are struggling to keep up with the acuity and demand. We are also struggling with this crisis at CAMH. Over the past months and years, our emergency department has been seeing more and more people with complex mental health and substance use problems. Between 2014 and 2021, the number of people visiting our ED due to amphetamine use, mostly meth, increased by more than 700%. The number of youth visiting CAMH's ED due to substance use problems increased by 50% between July 2022 and January 2023. During that same time, the number of youth visiting the ED due to suicidal thoughts or self-harm increased by 48%. CAMH and other hospitals in the city are also seeing an increasing number of repeat patients in our EDs. These patients typically do not need acute care, but are showing up at hospitals because they have nowhere else to go. Most of these individuals are actively using substances and have behavioral and self-care challenges that make them ineligible for shelters. They need flexible, supportive housing that offers a range of health and social supports, but that housing is difficult to come by in the city right now. There also isn't a lot of supportive housing with high levels of support for people with chronic and severe mental illness. At CAMH, about 1/5 of our inpatients are ready for discharge, but are stuck in hospital because of the long wait times for the few high support housing units that do exist in the city. This mental health and substance use crisis that we are experiencing in Toronto today is complex. The challenges are significant, but they are not impossible to overcome. As outlined in Our Health, Our City, an integrated approach to mental health, addictions, substance use, and the social determinants of health is critical for addressing this crisis. We must ensure that all Torontonians have access to the range of health and social supports that they need for their mental health and well-being. Of particular importance is a comprehensive and holistic approach to addressing substance use disorders. The call from Our Health, Our City to expand access to high-quality, evidence-based, and client-centered services, particularly treatment and harm reduction, is one that we wholeheartedly agree with. CAMH is looking forward to working across city departments with other service partners, businesses, local community, and all Torontonians to respond to this comprehensive plan. We need all of us together to build a healthier, safer city where everybody belongs. Thank you.
Thank you, Ms. Shields. Any questions for the deputants? See none. Thank you so much for coming in today. And next is Dr. Dan Werb, Center for Drug Policy Evaluation, St. Michael's Hospital. Are you here?
He was online, but he's dropped.
Okay, dropped off the call for now. Next is Diane Chester, Niagara Neighbors for Community Safety. Okay, you have 5 minutes to present to the board. Go ahead.
Thank you for the opportunity to speak at the Board of Health today and for this important and comprehensive new strategy. I'm a member of the Niagara Neighbors for Community Safety, a group of hundreds of parents, residents, and businesses in the downtown west area of Toronto. We recently came together after learning in mid-September through a rumor, and not from the City of Toronto, that a 24-hour low-barrier respite site would be located in the heart of our neighborhood at 629 Adelaide Street West, opening early 2024. We noted in your strategy that these facilities are a significant part of your plan to resolve the addiction and mental health crisis in Toronto. Just a bit of background. I retired from the City of Toronto more than a year ago. After nearly 20 years of service, my first job was with Toronto Public Health in media relations during SARS, and then in communications, including being involved in the 2005 Toronto Drug Strategy and public consultation meetings. Eventually, I moved over to Toronto Water, where I became the program manager in the general manager's office. My work involved reports to council and committees, issues management, overseeing divisional communications. I was fortunate to be involved in a number of multi-divisional issues, including the complex issue of lead in drinking water and public consultation related to basement flooding and various policy issues. I've also been involved in neighborhood issues. In the early 2000s, myself and my condominium members deputed here at the Board of Health against perchloroethylene used by dry cleaners in residential areas. In our building, the venting for dry cleaning equipment was planned to be located directly beneath condominium windows. We won the fight, and the dry clean equipment was not installed. Last year, Toronto Hydro was upgrading a hydro vault that butts up directly against my property. They sent a poorly worded notice to me advising that as part of construction to upgrade the vault, they were going to remove my entire back fence and dig up a significant portion of my yard. After dozens of phone calls and emails to find someone to speak with, I eventually had them agree to a site meeting. In the end, the contractor actually found a way to rebuild the vault structure without any impact to my property. This took hours of time to negotiate. Since then, I've been involved in a number of other issues. For example, a bar was planning to open with a large patio beneath condominium balconies. We fought against it and won. The bar did not open. It's a Tim Hortons now. My point in saying all of this is that in all these cases, I was told I had no input, which leads me to the Toronto City Council delegated authority allowing city divisions to place shelters and respite sites in neighborhoods with no proactive consultation at all. Our community has been told publicly by the City of Toronto in really no uncertain terms that it's really none of our business. The 24-hour low-barrier respite site that was being considered at 629 Adelaide Street West, now suddenly a 24-hour emergency shelter, is in a cul-de-sac surrounded by homes, schools, laneways, parking lots, dead-end areas, and is 2 blocks from a safe consumption site and other social service facilities. It's not the right location for this facility. We've asked multiple times for evidence-based reports on many issues, including public safety, no response. And at no time has anyone for the City of Toronto said to us, here is a really good example of a well-managed respite site or shelter that our community will experience. It seems to me that would be a really helpful response. So lacking any information as to how these sites are managed, we visited other 24-hour respite sites. 21 Park Road was particularly stark, where we spoke with residents in the neighborhood and visited the local rabba. The residents and business experience was shocking. I won't go into details, as I know you must be aware of the neighborhood issues. In fact, the daily meal programs were recently canceled as a result of public safety complaints. We knocked on doors surrounding 25 Augusta Avenue, a former 24-hour respite site. We heard similar stories from residents and also saw on social media a multitude of serious public safety issues. The 2021 Street Needs Assessment Report reported 50% of people living on the street have a mental health issue, and 42% may also have a substance abuse issue. And this has likely increased since 2021. The problem is, it's been publicly stated that there's really no ability for the City of Toronto, the facility operators, the police, nor the street patrol folks to support guests once they leave these sites. This is, in fact, one of the biggest impacts to neighborhoods. The current approach to siting facilities, it's not a balanced approach. Our community has spent hundreds of hours calling and sending letters with our questions and concerns, including asking for face-to-face meetings. Personally, I have repeatedly sent emails with questions and requests for meetings with no response. The first strategic principle in this new strategy is entitled Health and Community Safety for Everyone. These facilities, as they're currently planned, designed, programmed, and managed, do not help to create safe new neighborhoods. Please remove the delegated authority and engage in authentic and genuine community consultation before citing these facilities. Thank you.
Okay, thank you. Any questions for the applicant? Seeing none, thank you. Next is Nancy Blades, Law of Community Services. Please note that item 8.1 is about our health, our city, mental health, substance use, and harm reduction strategy, not about 24-hour respite. You have 5 minutes.
Thank you for addressing the critical intersection of mental health, addictions, homelessness, and the need for housing to help improve overall health and well-being of all Torontonians as outlined in this report. LOFT provides mental health services, addiction supports, and housing supports for youth, adults, and seniors in Ontario. At LOFT, our commitment to harm reduction approaches is unwavering. We recognize the impact that harm and death have on our city, and we are dedicated to implementing strategies that mitigate these effects. At LOFT, we wholeheartedly endorse the placement of supervised consumption services and mobile crisis teams where community needs dictate as outlined in the report. It is our collective responsibility to ensure that individuals have access to the most basic needs while simultaneously improving the availability of support that enhances safety and prevents unnecessary overdoses and fatalities during this crisis. I cannot stress the importance of having low-barrier services that address and respond to people's needs in the moment, such as 24-hour crisis services, as well as comprehensive services that provide wraparound supports of ongoing wellness. It is crucial to diminish the criminalization related to mental health and substance use and expand services like RAM, rapid access to addiction medicine, and safe use sites for folks residing in Toronto and the surrounding areas. Failing to do so jeopardizes the safety for all communities. To realize these goals, additional funding from all levels of government is imperative to support innovative initiatives. Equally vital are supportive policies promoting wellness and a healthy work-life balance. Additionally, we must value and prioritize the voices of individuals with lived and living experience, acknowledging their unique insights in shaping effects and solutions. Regrettably, in the last 2 weeks alone, we at LOFT have mourned the loss of 3 client passings due to suspected overdose in our housing, as well as the countless losses our teams in housing, shelters, hotels, and providing mobile outreach services have experienced in the past few years. Our staff have been responding to overdoses, providing life-saving measures, also finding themselves tasked with the heartbreaking duty of having to call loved ones to inform them. The impacts of trauma, grief, and loss on direct service staff, as well as the devastated family and community members, cannot be overstated. It is paramount that we continue to build on the incredible work that is already happening across the city so we can truly meet the needs of our participants, our colleagues, our neighbors, and our communities. This impacts all of us. At Loft, our mission is to help people achieve their optimal health and well-being in the community by offering unwavering support and health. Our mission aligns closely with the vision and missions of Our Health, Our City strategy, and we eagerly anticipate continued collaboration to advance the strategy forward to a healthy Toronto. Let us unite in our shared commitment in creating a city where everyone can thrive and where collective health and well-being in our community remain the forefront in our efforts.
Thank you very much. Any questions for the deputants? Seeing none, thank you so much for coming in. Next up is Anthony Williams. Are you here? Is he online? No, okay. Monica Smith, are you here? No, okay. Mike Hager. No, not online. Oh, okay. Gil Panisola, Toronto for Everyone. You here? You have 5 minutes to present to the committee, to the board.
Thank you. First, I want to thank the Chief Medical Officer for all that she has been doing for years. I met her when she was leading Peel region, and I thought that Toronto was very lucky to have gotten her, not only to take us through the pandemic, but even more now to take us post-pandemic into a city where everyone will be able to live healthier and happier. I think that this initiative on mental health is very important, very timely, and I completely agree on the analysis and the symptoms and the structure. But I think that it's also important to be bolder and to be more engaging. I wish that the medical officer was on almost all of the committees in the city, because at the end of the day, everything that we do in the city is about health. Whether we are talking about walkability, or we're talking about public transit, or parks, or housing, it's about mental health. For example, you take the subway east, and everybody seems kind of down. As soon as the subway goes over the Don Valley, you cannot see people smiling. It's so nice to see sun and trees. So those are the things also of public health. When all of a sudden the premier changed Eglinton West for above ground to underground, no one ever talked about the impact on happiness. If they had asked people, if you're gonna go on the same train at the same speed, would you rather go underground or above ground? Probably most 9 out of 10 people would like above ground, feeling safer, looking at the trees and the sun and the shops, that underground, maybe 9 out of 10 rodents would be going underground. So I don't think public health is in a lot of these issues. Housing, we need density all over the city. We know that we have the same density with 5 stories next to each other than with 50 stories every other block. We should ask the medical officer to evaluate if we should be doing more 50 stories or more 5 stories if we're going to get the same amount of units. Because many studies around the world show that in 5-story buildings, you develop a lot more community, a lot more sense of belonging. So it's an issue of public health. How high are we going to do those buildings? Same density, but which is going to be better for health? Also, I think that we should work on issues such as walkability. And I think that's also, that is not enough. The magic pill, there is no magic pill. If there is a magic pill, it's called physical activity and socialized. And the only way that Toronto is going to be physically active, the only way, is if we walk or bike as a normal part of everyday life. It's the only way. There is no other way. People might play a sport once or twice a week, but we need to be 30 minutes a day for 5 or more days a week. 1 out of 4 streets, 24% of the streets of Toronto do not have sidewalks. It's sad, 24%. And not only that, but when last year, 2 years ago, it was approved that they were going to listen to the staff, 30 minutes later, the mayor and some councilors said that had a motion that the local councilor could veto. It's crazy. How can they veto? The sidewalks is almost a human right issue. Sidewalks are the life of the city. Sidewalks not only move people from point A to point B, as it happens on the streets, but sidewalks is where people meet boyfriends and girlfriends, and we meet our neighbors, and we meet the people that sell flowers and fruits and coffees. Sidewalks is a human rights issue. Every street in a civilized city should have nice sidewalks, hopefully with trees and benches and lights and all of this. So I think that this report also should have issues related to sidewalks, bikeability. Also, we need a network. I rode my bike here. There is not one single bike lane from Bloor to the lake, not one. We have built some east-west, but nothing north-south. There is not one single connection. So things like that. Parks. We need parks, and more than parks, programs. It's not only about finding the millions for infrastructure, but the thousands to make it work. We need programs, not just the trail, but the walking groups, the knitting groups, all kinds of activities in the groups, which also has to do with things like trees. Toronto has 28% tree equity, but in the wealthy neighborhoods, we have over 40%. In the low income, less than 10%. We should eliminate all of that. So all of this is about mental health.
Closing thoughts, please.
So I want to thank you, and I hope that it becomes broader, bolder, and that this program of mental health really becomes citywide, so that under the umbrella of a healthier and happier Toronto is how we should evaluate anything we do in the city.
Thank you. Any questions for the deputants? Seeing none, thank you for coming in, Mr. Penisola. Next up is Jill Patrick. You have 5 minutes to present to the board.
Thank you very much. My name is Jill Patrick. I'm a Torontonian. I'm a resident of a neighborhood in Ward 10, Spadina, Fort York. I'm here today because every Torontonian should be able to see themselves represented in this strategy. That's what it says in the introductions to the report, and also the strategy rather, and everyone has a right to health and to feel safe. The strategy highlights the importance of collaboration to achieve the highest goals of a civil society. The Toronto Strong Neighborhood Strategy, which I'm mentioning because it is referred to in the strategy itself, page 30, identifies participation in civic decision-making as one of the 5 domains of neighborhood well-being. Participation in civic decision-making is about the opportunities for neighborhood residents to get involved in making local and citywide decisions. It includes voting in elections, but it also means working with neighbors to make plans and priorities. It supports community well-being, which is a health consideration. Unfortunately, the ideals presented in Our Health, Our City don't translate into practice, and I specifically want to refer you to the partners table. The goal for 5, improve access to housing. You will see that there are 4 partner categories that are excluded from participating in this goal, the actualization of it. These partners are school boards, colleges and universities, business owners, employers, community groups, community leaders, faith leaders, and all Torontonians. What you see in practice here is the delegated authority, and sorry to mention it again, but this is very relevant to well-being of communities. It was granted to city staff to make site selection decisions without consulting with neighborhoods. The community engagement process was changed to reflect this new way of doing business. Bylaws were amended to remove perceived barriers to the siting of shelters. Despite claims made from city staff that there was no planning rationale for separation distances, it is abundantly clear that the city had plenty of reason to believe the siting of a shelter could have an unwanted impact on a neighborhood. For many years, residents and councillors have been calling for protections for residential areas and schools. There is ample evidence, not only in the media, but in your own committee records. To my mind, the City of Toronto has a duty of care to undertake a study based on the documented concerns raised by residents and by your own councillors. The study needs to look not only at the siting of shelters, but also at the activities and functions of shelters, which you know have changed drastically since 2003, with the addition of wraparound supports, which include harm reduction and crisis management services, which weren't there before. So these shelters are now morphing into what I would say, I think every shelter now is a crisis center. And I think we need to acknowledge that and the impact it has on the neighborhoods that are being asked to accept them without being consulted. The study needs to also include the impact on the neighborhood of siting a shelter, especially if it's in a high-density residential area and also near a school. These are things you've heard over and over again from us. An objective study would provide city staff with the information and data required to confirm or deny a planning rationale for separation distances or any other kinds of protections. In my view, it is irresponsible of the city not to conduct such a study, and I don't think you can proceed with the siting of shelters without such a study. It is really unfortunate also that the medical officer of health did not see fit to mention any of this in the strategy or in the report for action, because taken together, all of these changes have obliterated the right of every neighborhood in this city to participate in civic decision-making related to the siting of municipal shelters. So, almost done.
Again, before you continue, I have stated this already, that this is not about 24/7 respite centers.
It is about the right of
do
a citizen
understand
to make decisions and the effect on their well-being, for that to be taken away from them.
Your final thoughts, please.
Okay, so I have 15 minutes.
After you
15 seconds, yeah.
I'll give you 2 minutes.
So what I'm
2
saying, I
seconds.
think it's counterproductive to say you want to build up healthy and resilient neighborhoods while taking away basic rights that are key determinants of a neighborhood's well-being. Councillors need to consider what they have done and take action to restore the rights that have been wrongfully taken away from residents. The strategy before you, I think, is incomplete because it doesn't represent the full spectrum of community concerns, mine and my neighbors.
Okay, thank you for coming in today. Again, I'd like to just state again that this is about our health, our city, and not necessarily about 24/7 respite centers. So again, for anyone else who comes to speak to the mic afterwards, I may have to say you're out of order. No, there's no questions. Next person on the list is Karen Staktus from the 519. You have 5 minutes to present to the board. Thank you.
Ooh, way too tall for this. There we are. Afternoon, folks. My name is Curran Stickets. I'm the Director of Advocacy and Communications at the 519. As both a proud city agency and Canada's largest serving 2S LGBTQ organization, we're deeply committed to the health, happiness, and full participation of the communities we serve. And that includes people who use drugs. According to a 2023 study by the American Substance Abuse and Mental Health Administration, queer and trans people are 2 to 3 times more likely to have used illicit drugs in the past year. The CMHA finds that our youth are 14 times more likely to die by suicide or develop a substance use disorder. As an organization located in the downtown east, we are intimately connected to the ongoing drug poisoning and homelessness crisis. Our staff respond to dozens of overdoses a year, and as we've heard today, we are not unique. As you know, this is the daily reality of many community-based organizations and communities across Toronto. The work we do with people who use drugs is guided by the notion that we don't get well alone. We make each other well, and it's very heartening to see that throughout this plan we're here to discuss today. I'm here to offer our support and endorsement of this plan, and to specifically talk about crystal meth. Through TPH funding, we are one of the very few organizations that provide programming and outreach specifically focused on crystal meth. While crystal has long been disproportionately used by men who have sex with men, we are seeing increasing numbers both within that community as well as particularly within street-involved communities. People who use crystal can experience significant negative health outcomes, both from a social determinants of health lens as well as a clinical framework. Providing safe and affirming supports to people who use crystal can times be uniquely challenging, given the complex mental health challenges that may come with crystal use. We really appreciate the increased attention paid both to the specific needs of 2S LGBTQ folks as well as people who use crystal throughout this plan, and I want to talk to 3 points very briefly. First, as an organization, we cannot overstate the need for stabilization spaces. So often in our experience, all folks need is somewhere where they can go that's quiet, supportive, and be connected to resources, where they're treated with respect and the dignity that they deserve. Without these spaces, our community members too often end up in the ER or in custody. Second, much of the harm reduction work done in this city is done by peers, and much of that work is funded by Toronto Public Health. I urge via the Toronto Urban Health Fund. I urge you, as you look at building a charter for peer workers, to look at the funding cap within the TUF funding of $18,750 per peer worker, which leaves peer workers who are working 20 hours a week with an hourly rate of pay of just $18 an hour, which is far below a living wage. Finally, so much of harm reduction practice comes out of queer and trans communities and comes out of the AIDS crisis and the radical ways we had to work together to keep ourselves well. Our communities know that stigma is a very efficient killer. As you look at this plan and at its implementation, excuse me, I encourage you to center an understanding that this plan will not be effective if the services our sector provides stigmatize clients, and if the services themselves are stigmatized by neighbors and other stakeholders. We make each other well, and we keep each other well. I know this from my work, but I also know this as someone who struggled intensely with problematic drug use for about the age of 15 well into my early 20s. I know it from the people I loved from that time who are no longer with us. I share it because that's one small part of reducing stigma. We know that people get well when they are afforded dignity, people get well when they feel welcome, people get well when they have supports and they can rely on and a community they can call home. There's a lot of work in this plan to make that a reality in this city, and frankly, we all know in this province, to make it a place where being well is within reach. We're hopeful that this plan is one step in that direction, and we're committed to working with you in ensuring the success of this plan. Thank you.
Thank you, Karen. Any questions for the deputants? Okay, seeing none, thank you for coming in today, Karen. Next up is Mariela Alessa. Mariela Alessa, are you here? Okay. Mike Slade, are you here? No. Vincent Supta. Vincent Supta, no. Dirk Heyer, Chief Coroner, Office of the Chief Coroner. He's online, okay. Mr. Chief Coroner, you have 5 minutes.
Thank you very much. Let me get my video going. I appreciate the time and appreciate the board of providing us this opportunity. And I don't have a lot to say except to recognize the seriousness and the significance of this ongoing public health tragedy of people dying from substance-related harm. In our office, we investigate deaths, and so we continually see people dying, and most of those people at a young age, between 30 and 59, and that's a lot of life years lost from a preventable health problem. So we analyze and look at things with recognizing the importance of individual circumstances for the person who passes, but also we approach it in the same types of data are brought together from each individual death investigation to look at trends and patterns. And within those trends and patterns, we share that information with those who are in a position to make change or have a mandate to make change or to help to make things better. And we regularly share with organizations such as Toronto Public Health, but also all of the public health units across Ontario. What we've recognized through the work that we're doing is, as I've said, we continue to see an increasing number of young people dying from a preventable health issue, and it's a tragedy. Many communities, many people, many families, many have lost their loved ones, and so we try to bring that to the attention of everybody who's in a position to make that difference. What I've learned is we don't have, our job is not to provide solutions, but what I've seen is recognizing the importance of a collaborative approach with all of those who are involved with either prevention or intervention related to substance-related harm, coming together and figuring out the best pathway forward on a population health level. And recognizing that it's important to stabilize lives, so prevent people from dying at the moment that they're using or consuming drugs, and then also the importance of ensuring that there's recognition of the continuum of care that needs to be available, and where the individual may step onto that continuum of care, we need to recognize the importance of an individualized process and therefore different services at different points in different people's lives. So it really is that I bring to the table, that I bring to the board for recognition of the observations that we've seen over our years, recognizing this problem's been continually increasing from 2003 through to now, where we see such approximately 2,500 people dying per year in Ontario, and of those, the majority dying from fentanyl associated with stimulants such as cocaine and methamphetamine. So I recognize the time, and I wanted to leave opportunity for potential questions if anybody had any.
Thank you, Mr. Chief Coroner. Any questions for the Chief Coroner? Seeing none, thank you for coming in today. Much appreciated.
Thank you for letting me. Take care.
Dr. Dan Werb, Center on Drug Policy Evaluation, St. Michael's Hospital. I believe you're online. You have 5 minutes to present to the board.
Thank you so much. And apologies for being out of order here. I just wanted to speak a little bit on some of the emerging research on supervised consumption sites, given, of course, the conversation that's occurring across communities, the provincial review as well, and just share a little bit about what my group, the Center on Drug Policy Evaluation at St. Michael's Hospital, has found with respect to some spillover impacts, both in terms of potential negative spillover events and spillover impacts and positive ones. So just to provide a little bit of background, our group has worked with the Office of the Chief Coroner of Ontario to analyze data on overdose mortality across the city of Toronto over the past 5 or so years. And essentially what we did was we were trying to understand whether supervised consumption services influenced population level outcomes with respect to overdose, rather than only the outcomes experienced by their immediate clients. So, there's consensus on the capacity of supervised consumption sites to prevent people on site from dying of an overdose, but there's less understanding and really not a lot of data on how these sites actually impact neighborhood overdose mortality. And of course, if they do impact neighborhood overdose mortality, then we have to reconsider their potential cost effectiveness and their effectiveness as a key part of a community hub, and of course, a key part of the proposal that's been the topic of discussion today. So with that in mind, our group looked at the spatial distribution of overdose mortality across the city of Toronto. And we looked at the years prior to and after the implementation of 9 supervised injection sites in the city of Toronto, which all began to be implemented in 2017, 2018. And what we found was that, you know, and I just want to reiterate here, the data that we're using are data from the Chief Coroner's Office. So these are very, you know, this is population level data on, you know, the number of overdose deaths across the city of Toronto. And what we found was that after the implementation of supervised consumption sites, we saw on average a 67% reduction in the overdose mortality rate in areas surrounding the supervised consumption sites. So within 250 meters, we saw a rate reduction of 67%, so 2/3. We did not see, and that was a significant reduction. We did not see a similar rate reduction in areas in the city that did not implement supervised consumption sites. We then ran a sensitivity analysis and we looked at whether we expanded our area to 500 meters, whether we'd see a similar significant rate reduction. Then we expanded it further to 1 kilometer. Then we expanded it further to 2,500 meters. And then finally, we expanded to 5 kilometers. And in each case, we found that the implementation of supervised consumption sites were associated with a significant rate reduction of about 2/3, even as far as 5 kilometers away. And that this was not replicated in other parts of the city that did not implement these services. So this is work that'll be forthcoming very shortly in a peer-reviewed, high-impact peer-reviewed journal. I just want to mention that. We've also worked with the coroner's office to analyze homicide data and the spatial distribution of homicides across the city of Toronto. And I just want to very briefly speak about this because I know it's important to community members who's, you know, have concerns about safety and about potentially, you know, altering the way that supervised consumption sites are managed, designed, and located, which I just want to acknowledge are totally legitimate concerns. What we found when we analyzed the homicide rate and the spatial distribution of homicides across the city of Toronto starting from 2010 until 2021 was that there was no increase, and in fact, no association between the implementation of supervised consumption sites and any kind of increase or decrease, for that matter, in the spatial distribution of homicides close to these sites. And I'll just end it there, given that we're at time. Thank you.
Thank you so much for coming in today. Any questions for the deputant? Seeing none, thank you. Much appreciated.
I have no, oh God, Jesus Christ.
Councillor Fletcher, you're not on mute. Okay, thank you. Staff muted you. Next up is, yes.
Oh, I actually had a question and I got kicked off WebEx, so there you go.
Do you have a question? Is the deputant still here?
Yes, I did. Yes, but I got a WebEx problem.
Is Mr. Dr. Werb still on the line? Yes, he is. Go ahead, Councilor Fletcher.
So first, I'm very happy to give you all a little laugh today with that. Frustrations of WebEx are well known to all of us at the city. Can you just tell me again what the name of that study is and the auspices that it was undertaken, your group, please?
So the study on the spatial distribution of overdose mortality?
Correct, yes.
Yeah, so
oh yeah, that's right, I forgot.
Oh, I hear some crosstalk. So this is a study that was undertaken using data through a data sharing agreement with the Office of the Chief Coroners of Ontario. It is part of a Canadian Institutes of Health Research funded study called the Toronto Disparities, Overdose, and Treatment Study, which also includes a cohort of people who use drugs that we longitudinally follow across the city of Toronto over time. And preliminary results of the spatial analysis that I described have been previously presented at the Lisbon Addictions Conference, which is a peer-reviewed academic conference. and will be, as I mentioned, forthcoming in a high-impact peer-reviewed journal in the next coming months.
We shall be able to get read that and have a look at that.
Absolutely, yes. Yes, and I had some visuals that I was going to show, but just given that I had to exit and that were quite late in the day, I didn't want to share those. But Councillor Fletcher, I'd be happy to follow up with you directly and share some of those.
I would be happy to see those directly. Thank you. And did you take into account, oh, okay, so this is a deaths at home, not in your BC coroner looked at overdose deaths and found out that 80% of those deaths actually take place in a home setting. So I'm just wondering what your data set was for these deaths.
Yeah, it was every overdose mortality event in the city of Toronto. So these were events that occurred at home. These were events that occurred basically anywhere within the confines of the city of Toronto. And look, I think, these data are, there's limitations like there are for all scientific data. And so what our group has tried to do is understand, what is the potential causal association here, or even just any kind of association to explain what we found. And, what is clear about supervised consumption sites and why I think they fit so neatly into the broader proposal that's being presented here today is that they don't simply offer services for clients on site. They are hubs of naloxone distribution, for example. They're hubs of drug checking services. They're hubs of safer injecting education. They act as referral sites. And so I think it's the combination of the outreach that happens from these sites, and particularly I personally, in my opinion, I think that a lot of the spatial impact that we found is related to the fact that these sites can distribute naloxone and in a really low barrier way. So that's my personal opinion, but I think, other people, as they see the data, might have other interpretations.
Thank you. And I did miss one little thing, and then I'll finish, Chair, where you had said, I can't remember what it was, but just how well run it was vis-a-vis how important it is to have, but you didn't have an opinion on how well run it was, or you thought it should be well run, given it's in a community.
Well, yeah, I mean, I think every community service, of course, should strive to be well run. All I want to say is I acknowledge that, different supervised consumption sites are managed in different ways. They're designed in different ways. And I think a lot of, I've been studying this topic for about 20 years. And I think that there is absolute scientific consensus on what supervised consumption sites can achieve in terms of their immediate impacts, positive impacts on clients, on keeping them alive. I think the data that I presented today extends that to communities. And so I think the question that we really have, and honestly, despite the controversy here, I've been really galvanized to see that the tenor of the discourse is not around let's shut down all of these sites. It's more about how do we find a way to maintain their effectiveness while reducing potential negative spillover impacts. And I would argue that this really comes down to, some issues around design, some issues around resourcing as well.
Thank you. I'd love to get some of that data, and I wonder if you just agree with my rule of thumb, which is safe inside, safe outside, because you're sitting in a community.
Thank you.
Thank you. Yeah, sounds reasonable.
Thank you.
Thank you. I actually forgot that only board members can ask questions, so that was my bad. But
sorry, when did that start, Chair? When did that start?
That's always been the case.
No, it's not. No, I'm sorry. It's not always. I'm sorry to do that to you. It's not always been the case.
It's been the last 6 years ago, according to Councillor Perks, this happened. Anyways.
Well, maybe you change them back because I was able to ask lots of questions. We were talking about site safety.
I know you got me off guard. You caught me off guard. That's okay. That doesn't happen very often. The next.
Fix it, please.
Thank you. I know lunch is at 12:30, but we do have one more deputant, And I'm hoping that the committee will allow me to just have that one last debutant before we go to lunch. So may I have a motion to extend for 10 minutes? Councilor Bravo, all those in favor? Yeah. Okay. Pete Bombassi, founder, executive director, the Genwell Project. Are you here? There we go. You have 5 minutes. Then we can go for lunch.
Thank you. Yeah, the last thing standing between everybody and lunch. Great. All right, I'll be quick. It's really a great opportunity to be here, and I'm here in support of the Our City, Our Health program. Congratulations, Dr. Davila, and everyone who contributed to the development of this forward-thinking program. My name is Pete Bombacci, and I'm the founder and executive director of Canada's Human Connection Movement, the Genwell Project, where we're generating wellness through the power of human connection. We're a Canadian registered not-for-profit, and we're working to complement the work of Toronto Public Health and many other organizations across this country that are working to improve the mental and physical well-being of Torontonians and Canadians. We're a social health movement that's been working to educate, empower, and catalyze Canadians around the importance of their social health, which leads to a better mental and physical well-being. We want to swim upstream and build a positive, proactive, and inclusive approach to improving the mental and physical well-being of Torontonians and Canadians by building a more connected Canada. We must recognize that we've never been educated on the importance of social health to our overall well-being, like we have with physical health, eating, sleep, water, not smoking, and not drinking too much. And in a post-pandemic world where we have a long way to go to raise the collective consciousness and intentionality around our social connection and social health and its impact on ourselves and on the people around us. We do this on a national level through our website and daily postings with tips, tools, and ideas on how people can build healthier social connection habits starting today. We also do this in classrooms, communities, and workplaces across this country where people recognize the importance of our work, this message, and want to share it with their community. One example of our catalytic activations was last week was Canada's first ever Talk to a Stranger Week in Canada, where we found thousands of people striking up conversations with strangers because they recognize the impact that it has on themselves and on the people around them. There are many connections between social isolation, disconnection, and loneliness, as we've heard in some of the presentations today, and loneliness and the health issues of addiction, as well as many other individual and societal issues. Some of those include mental health issues, heart disease, early onset dementia, diabetes, obesity, addiction, suicide, as well as aggression, racism, extremism, and random acts of violence, all of which impact us as individuals and as a city. But the good news is that the research is greater than ever before about the power of human connection to help us build a more connected world, including it being the single greatest contributor to our happiness. It reduces anxiety and depression, increases empathy and compassion for one another, and is the single greatest preventative action to avoid depression, and yet we haven't spent time telling people about it. We are all part of the solution to the challenges that we face in this world. And it can start by the simple ways in which we support and engage with each other and those who are facing the challenging road of battling a mental health or addiction issue. It's not a road any of us would choose. The Genwell Project is happy to play our role in supporting the City of Toronto, its citizens, and the Our City, Our Health plan in building a more connected Toronto where everyone thrives. Thanks.
Thank you so much for coming in today. Any questions for the deputants? Seeing none, thank you so much. Much appreciated. Okay, we're in recess until 1:30. Thank you. If any counselors in their offices that are listening, please come to Committee Room 1. We need you for quorum. Thank you. Director Chandrasekhara, which item are you here for? Still item 8.1? Okay, because you have new people with you. Okay. No, we're not on. I'm still waiting for quorum, unfortunately. My colleagues are not here yet. So online, we have Director Singh, Deputy Mayor Morley, and Director Krishmer. In the room, we have Director Zhao, Director Chandrabalan. Yeah, that's fine. Yeah, thanks. I'm just killing time, just letting people know who's here. We're still missing one more. All right, awesome. We can resume. Thank you. Okay. We're good to go? Okay, wonderful. So we finished deputation, and we did ask the panelists some questions prior to the break as well. But I'm allowing directors to ask questions of staff, if you like. So are there any questions of staff on this item? Anyone online? No, seeing none? Okay. Well, then we'll go to speakers then. Who'd like to speak this item? Okay, I do have an item as well, but go ahead.
Thank you, Chair. I really appreciated the opportunity to work with my colleagues on Board of Health and with staff to really focus on a couple of things. Seeing that the social determinants of health are so clearly featured here as drivers of mental health, I think is very important. And the fact that there is a list of what is within Toronto Public Health to do. I think it's important to have big ambitions and then be able to say, this is where we're going to lean in. This is what we're going to focus on. Without big ambitions, we cannot get the support of the other orders of government because we can't get the support of the public. And I think a lot of this has to do with every institution, organizations, employers, governments doing their part, and the crucial pieces that have to do with the ecosystem of services that fall into the realm of healthcare, and particularly the importance of making sure that people are sleeping indoors, that there is a continuum into permanent housing through options that meet people where they are, and there's a range of needs out in our communities. So this is a positive step. As the chair for the strategic planning process, I'm also really looking forward to making sure that we're figuring out how the strategic directions that come out of that process really lift up the most important elements of this strategy. And I just want to close by saying that I really think that we need more champions for children. On so many levels, children are falling behind, and we focus a lot on we focus a lot, as we should, on a number of demographics. The situation that children find themselves in today is dire. The mental health information that we received is terrifying. The lack of mental health supports for the general population is really difficult. But for decades, we've had a shortage of mental health workers, doctors, services in Toronto and all over this province when it comes to children. Every day I hear of residents in my ward, people across the city, whose children are in psychiatric crisis and are not able to get support or help. And the pressures that young people are facing today with the existential threat of climate change, wars, compounded with the really terrible systematic questions that have to do with other forms of exclusion and discrimination. And then you add on top of that the affordability crisis, high inflation, impossible to pay rents for so many people. And even when it comes to the employment assistance program, that is a privilege to have. There are many, or the majority of workers who are working with low wages, don't have any benefits, don't have any job stability, and their children are suffering that consequence. So I think that focusing on the main systemic factors that drive inequality, and I really want to just lift up, as I know others have lifted up many other populations, that I would love to see an all-of-government approach to helping the children who helped to save the rest of us through the pandemic and made sacrifices that we're just starting to understand now, so that we make sacrifices for them as we go forward. Thank you, Mr. Chair.
Thank you. I'll give Deputy Mayor Malik a moment in case she wants to say something, and I'll just maybe speak in the interim. So again, I just want to say thank you to staff for putting this together. I do have a motion, actually. Yeah, put it up now. And thank you to staff. You know, it's been years of work to get this done. As some of you know that, you know, my background prior to being elected official is around mental health and addiction and underhoused. And I know that during the pandemic, even prior, that there was a sense of hopelessness, you know, around the city, and especially in my ward of Toronto Centre. You know, I've learned that 61% of social services for the city is actually in my ward. And so I see it every day with my own two eyes, and I know how, you know, dire it's been over the course of the pandemic. And of course, you know, prior to being here as a city council, as a school board trustee for 6.5 years, and I know the difficulty our students have experienced throughout the pandemic. And as the report stated, 55% of Torontonians are feeling well and good about things. But if you look at the education side of things, from students from grade 7 to 12, only 44% of those students feel well and excellent. And what's also very troubling for me is the 17% of those who contemplate suicide. So this strategy, Our Health, Our City, has, you know, I'm going to say it's a little behind in the sense which I've had this before us a long time ago, but I'm happy that it's here now and addressing it in a way that we are today. And as mentioned too, we've had many stakeholders who've had input in this report. It wasn't just staff here at the city or healthcare workers, but those with lived experience. And I was really happy to hear some of those people come in today to talk about their own testimonies as to how they've gone through the system and in how it's helped them over the course of their lives. So there is hope, right, in that. And I do hope that talking about hope, I do hope the province and the federal government come to the table and actually help fund the initiatives, the recommendations here in this report. But I do have a motion that's really talked about public accountability and tracking of progress. I think for a lot of people, we're very visual. And I think the motion I have on the screen here will hopefully address some of the concerns that some people have shared with me. So again, I just want to say again, thank you to all those that are involved in this. Yes, it took a lot of time to discuss this all morning, but it was so vitally important to hear from people and from staff and stakeholders. So it is a celebration, quite frankly. So, and I'm happy to be here to participate and celebrate with all of you. So thank you. Deputy Mayor Malik, go ahead.
Thank you very much, and thank you to all the presenters and everyone who spoke to this item. And I fully support the motion that Board Chair Councillor Moyes is putting forward. I've had the responsibility of chairing the board's drug strategy implementation panel and working with many people as we brought this strategy forward, including community stakeholders and advocates, those with lived and living experience, and those that are trying to make Toronto a fairer, more equal, more just, and healthier city. I've also had a chance to see the work firsthand that Toronto Public Health staff, Upala, Sonia, Vanessa, Sana, and of course, Dr. Davila have been putting into this strategy. Their tireless work has brought this before us and allows us to see a way forward that builds on the incredible work over many years, decades even, and allows us to strengthen that. City Council and the Board of Health made a commitment to take action on mental health related concerns, ensuring the well-being of every Torontonian and addressing the health and social impacts of substance use. And recent statistics that have been mentioned by so many of us are alarming. Mental health issues are the leading cause of disabilities in Canada, affecting 1 in 2 Canadians by the age of 40. When Councillor Bravo mentions that young people have to be at the center of our concerns when it comes to moving forward this strategy, that is very real. The evidence shows it. And I know, and I mentioned this before, we see and we feel it in our communities and in our circles. The Our Health, Our City strategy recognizes the urgency to address this, incorporating recommendations shaped by extensive engagement with experts, community stakeholders, and individuals with lived and living experience. No one is unaffected by the impacts of mental health and substance use. And we know challenges persist right across the city, especially coming through the COVID-19 pandemic. And as a city, we have to care for each other, create community, and build a city where our sense of belonging is strengthened. I'm honored to represent some of Toronto's most vibrant downtown communities, and I know the importance of policy-based mental health and harm reduction supports and how they can build a safer, more inclusive Toronto. Today, we heard from a number of deputants who are residents concerned about shelter going into their community, going into my community. And while that item is not before us today, the concerns are understandable and a primary reason for the work we are doing here and a primary reason for the strategy before us. I take community concerns seriously because, as I said, I'm a community member, I'm a neighbor, I'm a Torontonian too, alongside so many of us who have been involved in putting this strategy together. We have heard both in this report and from experts who have deputed with us today that the issues of mental health, substance use, and harm reduction will worsen in our city if we don't act with the seriousness we need and if we don't invite other levels of government to the table in a practical and actionable way. Taking the steps laid out in this strategy, our city will support those in need and it will support all of us. We agree that shelters alone are not the solution. It is just a step towards permanent residency. And that road can be lined with obstacles, including a number that are outlined and addressed in this strategy. This strategy is a path to reduce the stigma, create supports necessary, and find a way forward for everyone to succeed in this city. And this is work that we must do together across the city. Implementation of this strategy requires a concerted effort from city divisions, community organizations, health partners, government agencies, and again, our federal and our provincial colleagues. With dedicated staff from Toronto Public Health and a public advisory panel, we will keep this strategy on track in a practical way. And at the city level, we will be convening an implementation panel to work alongside the Board of Health to ensure that the actioning of this strategy remains a priority, not only through the committed leadership given by Toronto Public Health, but by us as a city as a whole, right down to us as individual Torontonians. In the past year, the city has taken important steps, such as last month's citywide expansion of the Toronto Community Crisis Service, where we have seen thousands of concerns involving mental health issues be addressed by trained social workers and experts instead of being criminalized or being addressed by police. We know more must be done, and in a city like ours, we should have everything that we need to thrive, and that's why this strategy also includes the mention of affordable housing, access to supports, and a sense of community and belonging. And once again, I want to thank staff and community members for their dedicated work on this strategy, and I look forward to working together as we create this implementation panel and take the next steps forward for a city that we can all be proud of. Thank you so much.
Thank you, Deputy Malik. Seeing no other questions, we'll bring up the motion. No. Do you have a question? Oh, comment? Sorry. Oh, sorry. Yeah, sorry. You wanted to speak? Go ahead. I was. Yes. So before you start speaking, ask to have the motion put. Sure. Here it is. So you have 5 minutes to speak to the motion and to anything else you want to around this issue.
Sounds good. Thank you. So I wanted to share this motion because I think Toronto Public Health is very well known to be data-driven in all of the decisions that they make, as well as when it comes to anything that they implement, they are constantly looking to measure suitable outcomes, making sure that what they're doing has important key performance indicators for its success. So I wanted to share this motion because with regards to decriminalization, it can be an area that has mixed results, especially in studies across Portugal to Vancouver to Portland. And this is one particular area where it's very important to emphasize the data collection and making sure that we are looking downstream, that all of the services we provide in terms of treatment, in terms of access to care, access to mental health care especially, is in place first before we move ahead too quickly, right? So I always want to make sure that we're making a strategy that is evidence-based and outcomes-driven. That's just all I wanted to mention on it.
Okay.
Thanks.
Thank you. Any questions for the mover? Okay, seeing none. Thank you. Any other speakers? Nope. Anyone online? No. Okay. So we'll go with the first motion, which was my motion. Okay, all those in favor of this item? Opposed? Actually, all those in favor of this item? Opposed? Carried. Thank you. Second motion by Dr. Zhao. All those in favor? Opposed? Carried. As amended? All those in favor? Opposed? Carried. Wonderful. Thank you. Next item is item 8, HL 8.2, enhancing immunization coverage for Toronto's school-age population. I'll have Dr. DeVilla introduce the members.
So with respect to 8.2, we will have a presentation. This is on enhancing immunization coverage for Toronto's school-aged population. An update for the board, also responsive to an earlier inquiry that came from the board at a previous meeting. And the presentation will be delivered by my colleague, Dr. Nakoshi Lemti, our Deputy Medical Officer of Health.
Thank you, Dr. DeVilla. And through you, Mr. Chair, I'd like to present a presentation on enhancing immunization coverage for Toronto's school.
Is your mic on?
Enhancing, is that better? Okay, sorry about that. So again, thank you, Dr. DeVilla, and thank you, Chair and members of the board. I'm here to present about enhancing immunization coverage for Toronto's school-aged population. If we can go to the next slide, please. Vaccination plays a crucial role in public health by preventing the spread of communicable diseases, and they have significantly contributed to the decline of many diseases, such as smallpox, polio, and measles. Continuous efforts to expand and improve vaccination programs includes catch-up campaigns to ensure that people of all ages receive the protection they need against vaccine-preventable diseases. In this year of 140 years of Toronto Public Health, I want to note and sincerely thank the dedicated healthcare professionals, researchers, and support staff who have worked tremendously during the COVID-19 pandemic. The health of our city was protected by staff across divisions in the City of Toronto, people working across sectors, including the community sector, and people and residents across neighborhoods. Their contributions have been instrumental in advancing vaccination efforts and protecting public health. If we can go to the next slide, please. Regarding children and youth, there are two major public health vaccination programs for students in Toronto: the Student Immunization Program and our program that covers the Immunization of School Pupils Act. In the Student Immunization Program, or SIP, TPH administers free hepatitis B, human papillomavirus, or HPV, and meningococcal vaccines in school-based clinics to grade 7 and 8 students to prevent cancer and serious illness. In the last school year, 2022 to 2023, TPH also for the first time went to all high school schools for catch-up as part of the extraordinary pandemic recovery work that was required. In the Immunization of School Pupils Act program, we know that prevention of outbreaks requires high routine vaccine rates. Under the Immunization of School Pupils Act, in the province, children are required to have 9 routine vaccines to attend school in Ontario, or to have a valid exemption. Toronto Public Health works with school boards and parents and families to gather and assess immunization status of school-age children for the 9 diseases covered by the vaccines listed in the ISPA. Families are required under the Act to report their immunization status or submit a valid medical or conscientious exemption. Students not compliant with the ISPA can be suspended from school under the Act. Next slide, please. The COVID pandemic necessitated the adaptation and adjustment of many public health services. Some employees were redeployed to support pandemic response efforts, and also schools and healthcare services operated virtually or with reduced capacity. These changes resulted in a backlog for routine vaccinations, which is a current health challenge. Misinformation and vaccine hesitancy have also become barriers to achieving high vaccination rates. In addition, at various points, we had some restraints in the supply chain, which affected the availability of vaccines. During the September 11th Board of Health meeting, the board asked for consideration of actions required to increase vaccination rates, specifically with respect to the Immunization of School Pupils Act requirements. The information in the following slides updates our situational assessment and proposes actions necessary to improve child and youth vaccination rates. Next slide, please. Delivery of Ontario's publicly funded routine infant and childhood immunization programs were impacted in 2019 to 2020, 2020 to 2021, and 2021 to 22 school years, due to the pandemic effects just described, including decreased access to in-person healthcare appointments and the redeployment of public health resources to the pandemic response. On this slide, you can see from the 2023 data the compliance rates for the student immunization program and ISPA vaccines, comparing rates before the pandemic in the 2017-2018 school year and the rates in the 2022-2023 school year. The reported compliance rates for all of these vaccines have decreased in those time periods. These trends in ISPA vaccine rates are consistent with the provincial rates published by Public Health Ontario in July 2023. And indeed, we know that some of these phenomena are being observed globally. Restoring routine vaccine rates to their previous levels will take time, and it will require dedicated effort that includes allocating resources such as funding and personnel to support vaccination campaigns. A comprehensive approach involving healthcare providers, schools, and communities can help promote a sustained recovery in vaccine compliance rates. Next slide, please. In response to questions raised at the previous Board of Health meeting, this table shows the median school level SIP compliance of current grade 8 students across the public English and French school boards, which total 396 schools in Toronto. This is compared to the overall compliance of grade 7 students following the 2017-2018 vaccine program in August 2018. That is to say, the first row gives you a sense of the pre-pandemic baseline. What I'm hoping that you'll take away from this slide is that currently, grade 8 compliance for all 3 antigen vaccines are all below the pre-pandemic compliance for the grade 7s from 2017-2018. HPV vaccine compliance is closer to pre-pandemic levels for more schools compared to the hepatitis B and meningococcal disease vaccine compliance levels. Next slide, please. Similarly, this table shows the median school level SIP compliance of current grade 10 to 12 students across the public English and French school boards. This is 146 schools, and the compliance by birth cohort of current grade 10, 11, and grade 12s. Currently, grade 10 to 12 combined median school level compliance for all 3 antigen vaccines are all below the pre-pandemic end of program population level compliance for grade 7s in 2017-2018. When we look at the compliance by birth cohort, there is decreasing compliance by birth year across all 3 antigen vaccines. Current grade 12 students who had opportunities for vaccination pre-pandemic have higher compliance rates than the pre-pandemic baseline for HPV and meningococcal disease, and slightly lower compliance for hepatitis B. Current grade 10s have the lowest compliance of the 3 birth cohorts across all 3 antigen vaccines. Next slide, please. Another request from the Board of Health was to be able to display some of this information to give you a sense of more of what it looks like across the city. And so here on this slide, you see an analysis across our geography. It does show variability in SIP compliance across the city. Many schools in the west of Toronto had the lowest compliance across all 3 vaccines. And the way you can determine that is if you look at this figure, it shows a distribution of English public elementary schools by the overall score of vaccine compliance across the 3 agents that are in the student immunization program. Once again, that's hepatitis B, human papillomavirus, and meningococcal vaccine. A school with a rank of 1, marked by the color dark red, means the vaccine compliance of all 3 antigens for that school are within the lowest 25th percentile of all schools in that category. A school with a rank of 5, shown in the color dark green, means the vaccine compliance of all 3 antigens from that school are within the highest 25th percentile of all schools in that category. So the takeaway message from this graph, which is very colorful, is that a greater number of elementary schools with the lowest 25th percentile vaccine compliance in all 3 antigens are located in the west of Toronto, especially the north and central west. Next slide, please. Similarly, this figure shows the distribution of public English elementary secondary schools by the overall score of vaccine compliance, again across the 3 SIP agents within that school. Like in the previous slide, a school with a rank of 1, shown with the color dark red, means the vaccine compliance for all 3 antigens for that school are in the lowest 25th percentile of all schools in that category. Again, a school with a rank of 5 in dark green means the vaccine compliance for all 3 antigens for that school are within the highest 25th percentile for all schools. Many of the secondary schools with the lowest 25th percentile vaccine compliance for all 3 antigens are located primarily in the northwest of Toronto. Next slide, please. The current channels available to immunize students, both in the target age group and those requiring catch-up vaccinations, are schools, Toronto Public Health clinics, and primary care settings. For the student immunization program, currently vaccine availability is in the routine grade 7 school-based TPH clinics with catch-up invitations to grade 8 students. And currently families can also catch up SIP doses at the 4 TPH fixed site clinics. For vaccines named in the Immunization of School Pupils Act, meningococcal vaccine is available in grade 7 and 8 school clinics because it is one of the diseases listed that is also part of the SIP program. Currently, all ISPA vaccines are also available at TPH fixed site clinics or in primary care. I cannot underscore how critical TPH clinics have been in reaching students who missed doses in the pandemic. At the end of 2023, the TPH fixed site clinics, previously known as our mass immunization clinics, that offer student immunization program, ISPA, COVID, influenza, Mpox vaccines, and other vaccines will no longer be operating due to the end of pandemic funding. These have been crucial not only for catch-up, but also for response to emerging situations, such as 2 serious preventable disease exposures, for example, that occurred within the last 5 days. The described gaps will mean that comprehensive catch-up for child and youth vaccinations will rely on primary care, which is a strain and also limits access for those without a primary care provider. Next slide, please. To enhance vaccine coverage, an increase in our capacity to administer vaccines and continually assess our progress is necessary. Expanding vaccination infrastructure and tracking progress can help us ensure that more individuals receive the vaccinations they need to prevent outbreaks, reduce severe disease, and maintain public health. We have an opportunity to build on the momentum created by COVID-19 vaccination efforts and apply those lessons to our broader immunization programs. As I said, Toronto Public Health clinics have been critical in supporting catch-up efforts. Next slide, please. Restoring vaccine coverage levels after pandemic disruptions will require resources, including funding for vaccine procurement, distribution, and administration, as well as resources to support public awareness campaigns. In 2024, enhanced staffing would be necessary to extend our reach in promoting, supporting, and offering vaccinations in community settings. To achieve higher vaccine coverage, we also know it's essential to address the vaccine hesitancy and counteract misinformation. Education, open communication, and engagement are key tools in increasing vaccine confidence. We're aware that focused support is also required to reach equity-deserving populations to bridge any disparities there are in vaccine rates. Community-based vaccination programs can reach underserved populations and provide more accessible options for vaccination. If you can go to the next slide, please. So all of this information I've just talked about is the foundation for a recommendation from the Medical Officer of Health through a recommended motion here to the board. This motion does not imply that complete recovery of pre-pandemic immunization levels is likely in 1 year, but in the current environment, it involves a one-time funding request to the province to fund efforts to make our continued catch-up achieve more based on the experiences learned from pandemic response. Thank you.
Thank you for that presentation, Dr. Lamptey. Any questions from directors? Okay. I have a few then. Yeah. Oh yeah, sorry, yes, sorry. A little off today. We do have two public speakers on this item. Skylar Hill-Jackson, are you here? Okay. Dr. Lamptey, do you mind just, can I have a seat anywhere else? You know what I mean. lots of seats for you. You have 5 minutes. Staff can assist you. Yes, I got the thumbs up over there. Yes, it's on. Okay. Okay, you have 5 minutes. Go ahead.
In the 1950s, children had 14 doses of 5 vaccines. In the 1980s, children had 22 doses of 7 vaccines. According to the current Ontario Childhood Vaccine Schedule, my 5 grandchildren are now supposed to have 75 doses of 18 vaccines. Is the Toronto Board of Health promising that all these vaccines will keep my grandchildren healthy with this Enhancing Immunization Coverage for Toronto School-Age Population Initiative? A 2018 Raising Canada report conducted by the O'Brien Institute for Public Health concluded that there is a failing state of children's health today. Did you know there hasn't been one placebo-controlled trial to test the safety of vaccines? I'm pausing to let that sink in. Not one placebo-controlled safety study. Did you know that there are no studies that test the safety of combining multiple vaccines on the same day and within short time periods of time, despite the huge increase from 5 vaccines to 18 vaccines in a few decades? This is so important, I'm going to repeat myself. There are no studies testing the cumulative impact of the 18 vaccines in young children. We don't know whether 72 doses overwhelms many children. We also don't know how to identify the children most susceptible to negative reactions. What we do know is that chronic illnesses have risen dramatically amongst young children. Asthma, chronic eczema, allergies, ADHD, and autism. We don't know the reason or reasons, and I'm not aware of any research studying this. Our Toronto schools are full of unhealthy children, many requiring EpiPens, nut-free zones, and special ed teachers. Why are our children so unhealthy? Studies are emerging that show unvaccinated children have extremely low rates of these chronic conditions. A book was just published at the end of August that looks at over 100 studies in the peer-reviewed literature that considered vaccinated versus unvaccinated populations. If you are interested in informing yourselves, the title is easy to remember. Vax versus Unvaxxed, Let the Science Speak, and it's available on Amazon. Parents and grandparents are understandably concerned, aren't you? Blind trust in pharmaceuticals, politicians, and public health authorities is not supported by history. They were wrong about thalidomide. They were wrong about DDT. They were wrong about tobacco. They were wrong about asbestos. They were wrong about mercury. They were wrong about Vioxx. And they were wrong about opioids. Doesn't this merit caution? Please remember, first, do no harm. Let's keep schools focused on learning and creating an environment that optimizes learning. We know that families are struggling with the cost of food, which is fundamental to children's health. Let's bring healthy foods to schools, particularly in neighborhoods that need it most. Healthful food supports a healthy immune system. Following the medical precautionary principle, the default position for vaccination must be recommendations, not compulsion. Compulsion not only undermines trust, but limits the fundamental rights to life, liberty, bodily integrity, informed consent, privacy, and to parental decision-making. You may choose to look the other way, but you can never say again that you did not know.
Okay, thank you. Any questions? Any questions for the deputy? Okay, thank you for coming in today. Up next is Ian.
There weren't any questions?
No, they were not. Next, not is Ian Ware. Ian Ware. You have 5 minutes to
Thank you.
to the board.
This is unscripted because Ian had to leave for work. He expected to speak earlier today. But Councillor Gord-Perks, you...
Sorry, you're not registered to speak here today?
Ian had to leave for work, so could I not speak quickly just to ask some questions? He
Okay.
was here.
Okay, we'll allow you to speak, but do register with the clerk because we need to have you registered, okay?
Okay.
Thank you. You have 5
Councillor
minutes.
Gord-Perks, I am in your riding, so I appreciate us being able to be here together. We've been together before. And again, this is unscripted, but I feel like I had to say my children, my 7-year-old lost all her hair within 3 or 4 months. We don't know why. We went to 20 allopathic doctors and they said it was alopecia. That's it. Nobody could help us. One, the Chinese medicine doctor said, it's something you're eating, it's something in the environment. Only one. And we still haven't figured it out. My 13-year-old was suicidal. One of those statistics you guys were talking about. And she was suicidal because of what happened during the last few years. She felt lost, she felt confused, and she didn't feel supported. And you know what? I can see where she's coming from. My father was in the hospital a year and a half ago because he was coughing up blood. And then when that was 5 months after a shot, vaccination, and in the emergency room, they said that he wouldn't live. Call your family in. This is the last you're going to get to see him. As the crash room people all left, he coughed up these stringy blood clots that people are talking about now. And after he coughed up a whole bunch of them, his eyes rolled back into his head, his temperature came back up, and he's still alive today, though not well. All these things happening really, really make me question, what are the things we're giving to our family, our fathers, our children, my husband, and are they doing them harm? And if they are, do I not have a right to question them and wait I know we're here to talk about catching up vaccinations in school, but I want to wait. I just need to find out more information. I can't go through another injury, death. My daughter, it was already too much for me. So I signed that religious and conscientious belief exemption, but why wasn't I able to submit it? I've got it notarized. Why was the school not taking it? Why were they telling me that they don't put these in their files anymore? They told me I had to watch a video. I've decided I need to wait. I need time. As a parent, I need support. I need time, and I need time to make that decision. I do not want to be forced to comply and take something just on a schedule. I need time. And I think all of us should take the time to really ask the questions, who is this affecting, and why don't we have a right to ask for this time? Thank you. That's all I want to say.
Okay, thank you. Any questions for deputant? Okay, seeing none, thank you for coming in today.
I think there was a question. No? Okay. Is that
No.
everything? Thank you.
Thank you. Any questions from directors to Dr. Lemke? Okay, Councilor Bravo, you have 5 minutes.
Thank you.
You can stay 1 second. You can stay with your Dr. Lemke. You don't have to. Okay.
That's okay. So thank you for the update. Seems that I know at least in my ward a difference between the Catholic board and the public board in terms of take-up. Is that correct?
Through you, Mr. Chair. Are you speaking generally in terms of all vaccinations or a particular kind of vaccine?
Just the heat map that you showed with the red dots.
I don't know that I can say that we've perceived a difference between boards. I would say overall, I think the key takeaway is that overall compliance is lower across the city.
Okay.
There is a tremendous number of students that are missing doses, over 250,000 children. So it's a broad challenge, and the goal of the figures we presented was to help us potentially start to determine where the greatest need is.
Okay. Yeah, so I guess like as a counselor, you kind of know the neighborhoods, and we like several of us were like, whoa. So I just, you may not be able to comment on this, but from your perspective, is there the same approach with the Catholic Board and the TDSB? Is that some information that comes to you about how the message is being shared, or the facilitation of this is being kind of rolled out? I'm not, if you don't know, that's okay. Okay.
Through you, Mr. Chair, I'd like to maybe just answer a few components in terms of the immunization programs relationship, and then I'll maybe call on my colleague Nicole Welch to add any other comments with respect to the specific boards. But overall, we work with all four boards, all four public boards, at the level in terms of giving them the same information, and also having approaches where at the school level, we have teams assigned to be able to help the school communities be able to relay this information. So there is a universal approach where all boards are getting the same information. And then I'll turn over to Ms. Welch to add any other comments.
Thank you. No, that would, through the chair, that would be correct. Dr. Lemke, it's a universal approach when we're working with all four boards, other than the difference of when we're working with the French boards, our services are provided in French, obviously, and we do prioritize the schools based on how the schools prioritize the particular needs. And we worked very closely with Nakashi's team to determine areas where we are seeing lower vaccine rates, and providing additional support and focus, particularly to really minimize the impact of a suspension in those schools.
Thank you. I guess if I have, I can follow up with the school boards. So our approach at Toronto Public Health is universal, except for the language services in French for the Francophone boards. But how those resources are used, we would have to direct our questions to the different school boards to understand why the coincidence of how it looks mapped differently according to board, very, very significantly to the counselors and the committee anyway. Thank you.
So you, Mr. Chair, may I have a follow-up?
Yeah,
I
go
would
ahead.
just like to add that there are so many elements in the relationship between a family and a child and the system that's also ultimately going to support them to have a successful immunization. And absolutely, our relationship with the school boards is one element of that. But if you think about all the other elements that have to get you to understand the information, to have confidence in it, to have the time and ability to go and take up the resources, there's a lot of elements of that that I think have to do with more than just the board, right? Factors in daily life.
Okay. Any other questions? Deputy Mayor Morley, go ahead.
Thank you, Mr. Chair. Hopefully everyone can hear me okay. Through you, I just wanted to staff for their take on some of the information that was shared through the one of the deputants, just specifically with respect to the trajectory of expected immunizations for children as we move forward. And if staff could just speak to that to the best of their knowledge, whether or not that is accurate, an accurate depiction. The second piece, again, picking up on feedback from deputants, is around the exemption process. And if staff could speak to what that path looks like, what would qualify for an exemption, and how parents, should they feel, that they should proceed down that path, if that is in fact available to them, and what that looks like.
Okay, so through you, Mr. Chair, I'd like to state that every vaccine product.
Can't hear you.
I'll speak up. Through you, Mr. Chair, I'd like to state that every vaccine product is required to go through a multi-stage process to be approved for licensure and use in Canada, just like all pharmaceutical agents. So clinical trials are required before vaccines are licensed. That includes assessment of safety, effectiveness, and then even once products are licensed and used in the public, there is an ongoing monitoring and surveillance system to assure the safety of vaccines. And I think here we've made presentations this year about how that process works and how the public can participate in assuring the safety of our vaccine supply and system. The second point I think you were alluding to was potential concerns about the number of antigens that children may be exposed to. Was that your question? So I think there's two elements to that. Yes, the number of vaccines we have available has increased since several decades ago. And that is one of the reasons why we've been able to benefit from increased child well-being and decreased child mortality. If you look at the slide that I presented earlier from Toronto 140 years ago, unfortunately at that time there were many children who passed away from illnesses that we can now prevent through vaccines. The number of antigens that children experience is actually quite large in just their interaction with the natural world. And so receiving 2 or even 3 immunizations at one setting is actually a very small fraction of the number of exposures they have on a daily basis in the natural world. That's how our immune system develops its maturity. Is there any other element you'd like to address? I think those are the main things that I heard in your question.
Yes, thank you. That's very helpful. But also just the piece around exemptions. What qualifies for parents if they so choose or have other, medical or religious other concerns related to vaccination for their children? Is there in fact a process in place, and how do parents access that process?
Okay, so through you, Mr. Chair, under the Immunization of School Pupils Act, parents can submit a medical exemption from a qualified health practitioner if they're unable to receive a vaccine. They can submit that to Toronto Public Health. We entered into the records, and that will meet the requirements of the Immunization of School Pupils Act. Parents and families can also submit an exemption for conscientious reasons. And the requirement to view a video is a provincial requirement. After that, Toronto Public Health staff help families determine the correct paperwork to submit for their exemption to be entered into the record.
Okay.
Thank you.
Thank you. Okay, Director Zhao, go ahead.
I just had a question about suspensions. Do you know how many students are suspended as a result of not having their catch-up vaccines?
Through you, Mr. Chair. So that number is something that changes over time. So during the pandemic, Toronto Public Health did not proceed with suspensions. We were focused on immunization catch-up, notifying parents of overdue doses, and entering records and encouraging parents to enter records. So currently, we are in the process of notifying families in 3 of the school boards of missing doses as the initial steps that can result in a suspension. And the number of students in those boards is on the order of, and I'm saying on the order of because it changes, of course, with each letter, on the order of about 11,000 to 12,000 families have received at least the first letter. And I'm pleased to say that with the second letter, the number of overdue children has decreased. And that's the whole point of the assessment process. And then there is usually a third letter before suspensions, which could begin in January. With our largest board, the Toronto District School Board, the cohort is considerably larger. And we've also had to respond to changes in technology that occurred that has meant that process has required some finer attention and collaboration with the board. But the process is underway to prepare us to be able to do that assessment for Toronto District School Board students as well.
Thank you. It's just
If I
that,
may, sorry, Mr. Chair, just one little point to add here. You know, Dr. Lamptey has very nicely outlined our role in this whole process in respect of ensuring that children are afforded the protection of these vaccines that are now available. But just a reminder that the Immunization of School Pupils Act is a provincial piece of legislation. So the terms under which we're operating are actually described within that legislation, and we're affecting the role at a local level to ensure, again, that children have the benefit of the protective aspects of vaccine. So that is just an important component there.
yeah, so I just wanted to clarify. So it's the provincial government that is setting out the suspension requirement. Is that correct?
So through the chair, the terms are all articulated in the provincial legislation. It's called the Immunization of School Pupils Act. What we do at the local level is that which is done by local public health departments all over the province. And it's just a question of, you know, again, the scale and the scope of the operations that is required under the Immunization of School Pupils Act varies from jurisdiction to jurisdiction. And as it turns out, ours is the largest operation of this kind.
Got it. Great. Thanks for the clarification.
Okay. Okay, no one else? Okay, I have a few questions. So just to pick up on Councillor Bravo's questioning around the heat map as to where there's low vaccination rates. It was more in the northwest quadrant of the city. I've seen similar heat maps at the school board when it comes to suspensions and expulsions, for example. So it was the northeast or Scarborough. And there's also other heat maps associated with other things as well, and it's always similar. So my question is, you know, I guess you made the assumption as well, it's socioeconomic reasons that may be the case, but what are some other barriers there? Is it language? Is it culture? What exactly do you believe that is the root cause of that?
Through you, Mr. Chair.
Yeah.
So I think there are elements of what Dr. DeVille and I have heard in some of our visits to community agencies across the city, as well as our general understanding of what contributes to vaccine confidence and vaccine rates overall. So at a community level, we're hearing that families are very challenged right now with the pressures of finding affordable housing, finding affordable food, and I perceive that the stress associated with that means that responding to a letter from TPH to get your child immunized is just one additional stressor that might be hard to respond to. Second, we also know that there is a large gap in the amount of primary care services we have across the city and particularly in the Northwest. We've heard that from some of our community agencies. And many of these vaccines, the ISPA vaccines, are traditionally given in primary care. The third is, yes, language and culture can play a role, and we heard about the tremendous success of the community ambassadors that were deployed during the pandemic response that helped listen to and respond to the questions and concerns of various communities and provide resources in the language. And I don't just mean the written or verbal language, but the language of culture that made sense to them. So I think those are all some elements. And we know also that I think the pandemic experience has changed people's perceptions of vaccination. And it is probably going to take more considered, slow effort to build trust to be able to hear and answer those questions. I believe we just heard about people need time, and to respectfully give them that time to be able to feel comfortable with the information and have their questions heard means that probably the models that it will take to close these gaps will have to be different. We've had come to us for the last few years in the pandemic, and we're going to have to probably switch to, we're going to come to you and listen.
So this is a follow-up. So who are you targeting in regards to improving the percentages? Is it the parents or the students? And ultimately, whose responsibility is it? Is it public health, or is it the school system itself, or a partnership perhaps?
Through you, Mr. Chair, to you, Chair. Absolutely, I think it needs to be a partnership. I think many of us feel a collective sense of care for our children and youth, and the scale of this issue is going to require a collective caring response. So yes, we're going to continue to work with our school boards. We have strong relationships with them. We've accomplished many great things in pandemic response through those close relationships. But we also are going to have to draw on the advice and reach of some of our community partners who are trusted. And so sometimes that's going to mean not necessarily that TPH goes in and administers the vaccines, but we work with other agencies to provide the environment where people feel safe to come and feel comfortable and have their immunization needs addressed. So partnership is going to be key because the scale of this is large.
Okay. Thank you. Those are my questions. Seeing no other questions, speakers on this item? Okay, seeing none, so I will speak then. I do have a motion. I always do. You can put it on the screen. So there is a cost to promoting immunization and also the catch-up of that, especially during the pandemic. There's been a gap. And there is a $3.8 million funding that is needed to actually bring it up to par as to where we need to the current day. So I am bringing this motion forth to ask the province to give public health the extra funds needed to work with school boards to bring immunization up to the levels it needs to be brought up to. And to Dr. Lamptey's point, it is a partnership, all hands on deck, We know that immunization does save lives based on history. And so as a former student of the system, I know the value of immunization. So I think those are my comments for now. See no other speakers?
I'm just preparing it.
Oh, you have a motion? Okay. Okay. I'll hold down this item, 8.3, until the motion is prepared. No problems. We can move on to 8.4. Sorry, item 3. I'm going ahead of myself here. HL 8.3, Public Health Impact of Climate Change in Toronto, a path forward for responding to the climate crisis. Dr. Devilla, can you introduce the members?
Thank you, Chair Moyes. And we do have a presentation accompanying this item, 8.3. And this presentation will be delivered by another one of our Toronto Public Health colleagues, Associate Medical Officer of Health, Dr. Herveen Sachdeva. So I'll turn it over to Herveen, and you've got the slide deck in front of you now.
Thank you, Dr. Devilla. Hopefully you can hear me okay. Thank you for the opportunity to speak today about this report to the Board of Health. As you are all likely aware, climate change is not only an environmental problem. Global scientists, including many medical professionals, have concluded that climate change is the most pressing health issue of the 21st century. Coming out of the pandemic, there is an opportunity for Toronto Public Health to reestablish a focus on climate change and also consider lessons learned throughout the pandemic that can be applied to the climate crisis. Next slide, please. Public health has long been interested and had a mandate in understanding how the environment affects the health and well-being of the city's residents. The archival photo of the skyline on the far left shows what Toronto's air quality looked like in 1904, a time of increased industrialization. Through the years, public health has advised on water quality and air quality, among other issues. In the center, we see a photo of what air quality has looked like for most of my life. And on the right, we see a photo taken this summer from the same vantage point, when Torontonians experienced the air quality effects of wildfire smoke as a result of fires related to climate change. Note that you cannot see the skyline. After 3 years of advising outdoor activities to minimize respiratory disease transmission due to the pandemic, many may remember this summer as the one where people were told to cancel or consider moving activities indoors to protect their health due to poor outdoor air quality. Next slide, please. The environmental impacts of climate change are increasingly being felt by Torontonians. As shown here, climate models reveal that Toronto will continue to face worsening climate conditions. Our population health report to the Board of Health earlier this year included a recommendation to report back specifically on climate change. This report describes what is known about the current impacts on health, highlights the history of our work in this area, and recognizes the importance for TPH to re-engage in this work. Next slide, please. The domains of how climate change can and does affect health are shown here. In brief, these domains are through extreme heat, worsening air quality, severe weather events, vector-borne diseases, extreme cold, water safety and availability, food safety and availability, and mental health and well-being. And we heard about that this morning. Attachment 2 of the report shows a summary of select indicators of climate change and health impacts, as well as a sample of past TPH activities on climate change. Through short-term and long-term consequences to health, all of these domains can adversely affect health and lead to increased hospitalizations and premature death. Next slide, please. Climate change is affecting everyone, but as this framework outlines, the impact of climate change, the impacts are not experienced equally by all people. When assessing climate change health impacts, there are 3 general factors leading to vulnerability. Exposure, affected by things such as working outdoors, sensitivity, affected by things such as your age, and adaptive capacity, affected by things such as income. These 3 factors are ultimately affected by the social determinants of health. Given our mandate in reducing health inequities and in upstream prevention, this framework underscores the need for TPH to champion a public health perspective to climate change actions. Next slide, please. The recent annual report from Dr. Teresa Tam, Chief Public Health Officer for Canada, outlined how climate change actions, including mitigation, adaptation, and resilience, can be supported through core public health functions. Examples for each function are noted in the report. Health promotion, such as advocating and supporting active transportation initiatives, also something that we heard about this morning. Health protection and disease prevention, such as the TPH wildfire smoke response strategy. Population health assessment, such as the 2023 population health profile. Health surveillance, such as the West Nile virus surveillance program. And emergency preparedness and response, such as our partnership and collaboration on the city heat relief strategy. Toronto Public Health promotes this strategy through its communication channels. The Heat Relief Network has over 550 locations for cooling, had 550 locations for cooling in the 2023 summer season. Next slide, please. So this brings me to the recommendations. The first recommendation is developing a surveillance framework. A core function of TPH is tracking and surveillance of health events and health determinants through collection, analysis, and reporting of data. Improved data and surveillance would enhance our ability to fully understand the impact on the health of Toronto residents and help advance policy and strategic actions. In this work, TPH will continue to work with city, public health, and academic partners to reduce duplication and build on work that is already underway. Next slide, please. Recommendations 2 and 3 have to do with collaboration, internally and externally. Our city partners are leading key responses to the climate crisis, and TPH needs to continue to bring the public health perspective and voice to these tables, projects, and research, ensuring health impacts and health inequities are accounted for. Next slide, please. Recommendation 4 is reporting back on progress. In order to confirm our commitment to this work, we feel it's important to report back to the board on progress on these recommendations. That concludes the presentation. Thank you.
Thank you. Any questions from directors? I'll ask one question. How is this aligned with the net zero strategy from the city? I know, for example, there's a piecemeal approach, I'm going to say, when it comes to, let's say, TTC, fire, paramedic. Oh, sorry. This happens to me. We do have one public speaker. Pam Skinner is here. Are you here? No, it's me, it's not you. You have 5 minutes to present to the board.
Is this on? Yes, it is.
Okay, you have 5 minutes. Go ahead.
Excuse me. My name is Pam Skinner. I'm a resident of Toronto. And thank you for the opportunity to speak to the Toronto Board of Health agenda item, Public Health Impacts of Climate Change in Toronto, the Path Forward for Responding to the Climate Crisis report of November 13th, 2023. The majority of my information comes from the highly respected Geoengineering Watch and the 2023 documentary the dimming. I have 4 pieces of information to share that respond to the November 13th report. They are in regard to issues of climate modeling, climate change and air quality, climate surveillance, measuring, monitoring, reporting, and collaboration with other levels of government and other bodies around climate. So the first one, climate modeling. Climate modeling can be a useful tool. However, many climate models are missing vital climate geoengineering data. Climate geoengineering is the artificial modification of the Earth's climate systems. One type of modification is called solar radiation management, controlling sunlight before it reaches the planet. It uses reflective nanomaterials, aerosols, to reflect sunlight. The stated goal is to keep the Earth from warming by creating a global dimming effect. Another type is weather modification. And in 1975, Canada signed a Weather Modification Treaty, E103819, with the USA. Unfortunately, in both types of artificial modifications of the climate, the aerosols being sprayed are toxic and are harmful to all living things. So it is very important to include the geoengineering factor in climate models. The second item, air quality and climate change. Air pollution is a leading environmental cause of death and illness in Canada. Climate geoengineering contributes to poor air quality, and there's 2 examples. When toxic aerosols are sprayed in the sky, the aerosol spraying can contain any combination of aluminum, barium, strontium, graphene, and more, all of which are extremely detrimental to the health of humans, animals, and Earth's life support systems. Another source of poor air quality are the Canadian wildfires. Canadian wildland firefighters comment on how the fires are different now, hotter, more unpredictable. Again, climate geoengineering is playing a role. Because of the aerosol spraying, our forests are saturated with highly flammable elements that are not normal constituents of forests. The fire, the smoke, and other particulate matter have a significant impact on people's health. Third item, climate surveillance, collection, measuring, monitoring, analysis, reporting. It would seem important that future designs, uphold the principle of free, prior, informed consent. Example, if smart technology is used for the surveillance and monitoring, Torontonians should know ahead of time and be able to consent or not without negative consequences to them. B, as well, any further surveillance designs need to be able to look for the specific contaminants from climate geoengineering aerosol spraying. And finally, the design would need also to have the ability to measure aerosol elements, as these are very small, they are nanoparticles. The fourth item, climate collaboration.
10 seconds.
10 seconds. Wow. All right, then I'll go to my conclusion. If the medical officer of health could include in her work a climate geoengineering lens to inform climate action and public health work to stop climate geoengineering as part of health promotion, and include sovereignty and free and prior informed consent as part of climate change and public health plans.
Okay, thank you. Any questions for the deputant? Seeing none, thank you for coming in today. Okay. Any questions for, yeah, go ahead. Deputy Mayor Malik, go ahead.
Sorry, thank you. I do have just one question. Thank you for the presentation and for the work on this. And I think you've underscored what we've seen already, that climate crisis is affecting the health of Torontonians and people across Canada, and we have to take that very seriously. Without this framework, we know steps are necessary to take right now to address climate crisis concerns. So I'm just interested to hear a little bit more if there are steps at the Board of Health that we could take immediately in advance of the framework in order to address some of the most immediate impacts of the climate emergency.
Through you, Mr. Chair. I think one of the key components of this report is that Toronto Public Health can be an important partner, but actually many of the actions that are going to have immediate impacts on adapting to climate change come from many of our city partners. So we absolutely want to be at the table, but I think a lot of the recommended actions will come from them. What Toronto Public Health can offer is continued ongoing monitoring and description of how climate change is affecting the health of Toronto residents. And as we said earlier in some other topics, we do, I think, play a role sometimes in convening members of the public that might not necessarily be at some of these conversation tables, but the experience of the impacts on their lives need to be included in the full understanding of climate change and health for the city. So I don't think Toronto Public Health is proposing any specific immediate actions to respond to climate change. The main purpose, I think, here is to say we're recommending that we resume our continuing discussions with our other city partners.
And I'll just add through you, Mr. Chair, that we have our partners in other divisions are here. Can I think add to the question?
Through the chair and James Nolan, Executive Director, Environment and Climate Division, working very closely with Toronto Public Health already on some of these aspects of climate change and the intersection of mitigation, adaptation, resilience. And for example, we'll be bringing a report back with our divisional partners probably late Q1, early 2Q next year, looking at adaptation, resilience, the actions the city is taking, as well as opportunities to further those actions and provide for a governance framework, as well as looking at specific vulnerabilities. So we're already working with Toronto Public Health in a number of areas, and that will only, you'll see more of that over the next year, in particular on adaptation resilience, but also on mitigation as well as we bring forward various initiatives.
Okay, that's it. Thank you. Any other speakers on this item? Questions on this item? Seeing none? Okay, speakers. Councilor Bravo.
Thank you, Chair. I think I just want to say I do have a motion, but that the capturing of data, monitoring and describing impacts is so powerfully what Toronto Public Health can do to provide a baseline for our collective action around the impact of climate change on people. In addition to thanking staff for this report, I wanted to move that we add the following to recommendation 1. Consider both the outdoor and indoor contexts of areas of impact, air quality, extreme heat, extreme cold. And thanks to staff for helping with this. I think it's important that we monitor the impacts of climate change on health generally. When we know that it impacts people differently, I think about the people that live in rooming houses, many of which are in my neighborhood, and there is no escaping that heat. There is no mitigating it at home. So getting inside doesn't protect people entirely. It also, changes based on context. Some people live and work in buildings with poor ventilation. That includes workers. And I just really want to also thank the Toronto Environmental Alliance for alerting me to this and for bringing this forward, and also to tenant advocates like Acorn, who have been talking about this for a really long time. They've highlighted the understanding of how climate change is felt inside, which I've already talked about. And I think it also is important that we understand how these impacts are being felt outdoors by people who don't have a home and who are experiencing this in a very different way when getting inside isn't an option. So this motion seeks to ensure that when we are creating the surveillance framework, we're monitoring all of the contexts that face the people in our city, especially those people who are most profoundly impacted by social determinants of health that are placing them in a position of vulnerability. Thank you, Mr. Chair.
Thank
And I
you.
hope my colleagues will support it.
Yes. Any questions for the mover? Seeing none, thank you. All those in favor of the motion as amended? All those in favor? Opposed? Carried. Thank you. Okay. Awesome. Let's go back to item 8.2. And I believe Councilor Bravo had a motion as well. Is it ready? Put it up on screen.
Thank you. Through you, Mr. Chair, we're going to display the motion. This is something that we worked on quickly because of I think the need for counselors in particular to understand how the vaccination rates are differing across the city and the role that we might play. So this is a request for the medical officer of health to post immunization rates for public schools for hepatitis B, human papillomavirus, and meningococcal vaccines. We have a role to play in understanding how this is impacting residents in our wards, and I think also a champion role to play in relation to our partners in the school system, whatever one of the four boards are administering the program.
Thank you, Councilor Bravo. Okay. This one's on the, well, okay. It's okay. It's fine. Put mine up. Okay. All those in favor of this motion? Opposed? Carried. Second motion by Councilor Bravo. All those in favor of this item? Opposed? Carried. As amended, all those in favor? Opposed? Carried. That's carried. Thank you. And finally, we're going to go to item 8.4. So item 8.4 is HR 8.4, cannabis stores and revenue sharing. We do have one speaker on this item. Councilor Pasternak is here. You could stay there, Councilor Pasternak, and you have 5 minutes.
Great. Well, thank you very much. Nice to see Toronto Board of Health here. It's a pleasure to join you. So I'd like to talk on this issue as it originated from an administrative inquiry to the city manager. And full disclosure, I did not support the legalization of cannabis in Canada, nor did I support the retail distribution. But once the federal government, once council made the decision, there were certainly some enforcement and financial implications. So what we were told when this came to council on whether to opt in or opt out of retail, we were told that funds deriving from the sale of cannabis from a number of different sources would be used for enforcement. But we were also told that public health measures such as education, harm prevention, and other strategies through our various partners would also receive some of the funding. What we have received to date is about $9 million. And from what I can read from the city manager's letter, it's all gone towards enforcement. Now, most of the health and safety pieces have gone on the law enforcement side, from a law enforcement lens, handled by Toronto Police Services. And I can't see anything in the correspondence that I've received that indicates that Toronto Public Health has derived any funds from this. What we're really waiting for is the federal cannabis excise duty. which we were promised if excise duties exceeded $100 million, all dollars above that would be distributed over municipalities that opted in across the province of Ontario. So if you look at the 22-23 fiscal year, you're looking at about $210 million over and above the $100 million that was generated. And in the 23-24, it's estimated, based on the books of the province of Ontario, that it would be about $269 million over and above the $100 million. So across municipalities in Ontario, we should be receiving a share of $479 million. So to date, based on the correspondence I've received, we have not received those funds, nor a portion thereof. Now, it's hard to tell what our share would be, but based on earlier tranches of cash flow, under the Ontario Cannabis Legislation Implementation Fund, Toronto received about a quarter of the pool of money that was there. So I'm taking a guess here that it would be in the vicinity of about $100 million that flow the City of Toronto. So we want to do two things going forward as this works its way up to Council. The first thing I would recommend Toronto Board of Health do is advocate strongly that we fight for this money, and that it has been delayed enough times, and there are other jurisdictions that are also wondering where's the money. So we have to fight for this money, but also I think we have to be very strong about its allocation. There is no doubt that if you look at the legalization of cannabis and the retail selling of it, there were implications in our local neighborhoods regarding health and safety and mental wellness. And it is important that as these monies flow to the city, that those funds be allocated to those priorities. Substance abuse, mental wellness, harm reduction, medical interventions, and public education on these issues are the most important public policy imperatives of our generation. And this is an opportunity to advocate for not only the paying of these funds that were promised under the legislation, but also our ability to address many of the things that have been talked about earlier today that are plaguing our city. So I understand Chair Moyes has a motion that I have taken a look at, that I strongly support on this issue, and I thank you very much for your time.
Thank you, Councillor Pasternak. Any questions from any of the deputants? And Councillor Pasternak, I inadvertently allowed Councillor Fletcher to speak today at the Board of Health, even though it's not really our policy here. But for today only, if you'd like to ask questions, I'll allow it because I've done it already. No, of staff. Do you have any questions of staff, Councillor Pasternak?
I usually ask my questions beforehand. The only thing I would ask is, based on the numbers I have relayed and some of the public policy issues that we're facing, and the motions I assume you've perused, are we on the right course to getting somewhere in the vicinity of $100 million flowed through the city from the federal cannabis excise duty? And can we realistically fight for those funds to go into the public health issues that are priorities in the city?
So through you, Mr. Chair, I don't know that I'm the best person to speak to the Ontario Cannabis Legalization Implementation Fund and the amounts that are due to flow to the city or any part of the city. Like you, Councillor, I have the same information that was provided through the city manager, and I have no reason to think that it's misstated or that I can add anything further to that. However, what I will say is that I understand that there have been discussions, that there are motions that are here for the board to consider, and I do believe that what I've seen is quite responsive to the concerns that you've raised.
Great. Thank you very much. Thank you, Mr. Chair.
Yeah, thank you. Okay, seeing no other questions, anybody would like to speak to this item? Okay, seeing none. Okay, great. I do have a motion, and it's already, as alluded to by Councilor Pasternak and Dr. Davila, is really to address some of the concerns that were just mentioned. And if there's $100 million plus of dollars sitting somewhere at the province, I think that, it should flow to the city as it should. And so this motion is really to address that. And the third bullet point here is really for future funds that may flow through the city, and the way the system is set up now, that is the mayor's budget, that the mayor would use those funds to address the mental health, substance use and harm reduction and treatment strategy that we proved today. So I think it flows quite nicely here. So I hope my colleagues can support this motion. All right, so seeing no other discussion, all those in favor? Opposed? Carried. And that brings us to the end of our meeting. Thank you for everyone for staying and persevering, and it was a really good meeting. And I think we will see you in a little bit. The meeting is adjourned.